Hello, everyone. Are you able to hear us? Everybody, are you able to hear us? And now we would like to welcome you all to the season 11 of the DAMS Grey Matter quiz. We have been doing this quiz for last 11 years now, and this quiz has a lot of prestige to it. Every year, the people who win this quiz end up getting a top 1 or 2 rank in their NEETPG and INICET. We have seen this happen almost every year. Every year, this is like a dress rehearsal for your final exams. And so we are very excited to host this quiz for you, and we have a lot of legacy attached to, if you look back and see all the rank 1 interviews of INICET paper, you will find every one of them will be a previous DAMS Grey Matter winner in the last 11 years.
Even a participant. I think you've reached
many
this
of
far.
the participants also end up getting into the top 10, and so you are right now finalists. And I want to first of all also congratulate all of you on your massive achievement that you are finalists of this prestigious quiz. We have tried our best to keep the quiz interesting and tough at the same time, considering that you all are highly intelligent students. So we have tried our best to make sure that the quiz is challenging for all of you. And so that is the entire purpose, and at the same time interesting as well.
It's not going to be very difficult. It's just going to tickle your brain a little. Yes, so you bright minds only need a tickling in your brain and it sparks off, right? So we are very happy to have all of you here. Heartiest congratulations, and I'm sure that each one of you is very bright, and may the best team win today. But even others, when it comes to quizzing, it's all about on the spot thinking, how you can put down your previous knowledge, current knowledge, everything together. So all the best to all the teams, and we'll introduce the teams now.
And what we'll do is we will also we'll be conducting this quiz in 2 parts. We'll do it has total 6 rounds.
Yeah.
We'll do the 3 rounds, take a break, then we'll do the next 3 rounds. So this is how the entire quiz will be, so that if you need to have a glass of water in between or eat something, so after 3 rounds there'll be a break, and then we'll do the next 3 rounds. This we have team A from Kolkata, Mayuk Hazra and
Ashtagni
Mukherjee. So what we'll do is that anytime we are asking a question to team A, so all others can switch off their camera, so that only the 2 people who are answering can remain on camera, so that we can easily
focus
on who is answering. So are you here, Mayuk Hazra and
Ashtikagni.
Yes. Are you both there?
I'm so sorry, Ashtikagni. I think we have been pronouncing your name with difficulty.
Ma'am, actually it's Ahitagni.
Anitagni. Oh.
Anitagni.
All right. Wonderful.
Okay. Very good, beta. And Mayuk Hazra is also there, I think.
Yes. Great. Welcome.
Yes.
Welcome, team A.
Perfect.
All the best.
One is from Medical College, Kolkata. Other is from Arjikar Medical College, Kolkata. Team B is Dr. Shivan Singh from IIMS Banaras, BHU, and Soumya Behra from IIMS BHU. So Shivan Singh and
Welcome,
Soumya, welcome. Are you there? Just say hello to everybody.
Yes, good evening, sir. Good evening, ma'am.
All the best to Team B.
Team C is from Delhi, Akash Anand from Maulana Azad Medical College, Delhi, and Mukul Bhuria from ACMS, Delhi. So Akash Anand and Mukul, are you there?
Team C?
Yes. Good evening, sir. Good evening, ma'am. Good evening, sir.
Good evening, Team C. All the very best, bachas.
Thank you, ma'am.
Team D is Arush Thamija from AIIMS, Delhi, and Ayan Agarwal from VMMC, Delhi.
Team D, yes, I can see Ayan.
Yes, ma'am. Good evening, ma'am. Good evening, sir.
Good evening. All the best, bachas. Team D.
Thank you, ma'am.
Team E is Deep Bhuva and Devanshi Sa from GMERS, Gujarat. And we have a Team F also.
E, welcome.
Team E,
all the
welcome.
best.
And Team F is from South, from Monita Murugan from Government Vellore Medical College, Tamil Nadu, and S. Pragadish from Madurai Medical College.
Welcome, Team F. All the very best, bacha.
Good evening.
Are you able to hear us, Team F?
Yes, sir.
Yes, sir.
Yes, sir.
So we're going to start with the rounds, and we're going to start with round 1. And I'm just going to tell you the rules for round 1, bacha. Okay. So now in round 1, there will be a total of 12 questions. Okay. and each team will get 2 questions. And for first 6 questions, I'm going to start in the order of 1 and then go to or team A and then go to team B. And for the next 6 questions, it would be a reverse or an anti-clockwise order. There are no negative marks for round 1. And if you get the answer correct, okay, you will get plus 10 marks, everyone. And the time limit to answer the question is 30 seconds, bacha. Okay. Now, you can also pass the question to the next team, right? And only one pass is allowed. So for example, if team A passes, it will go to team B, but it won't be passed any further. So you can pass it once. And if the team which gets the question on the pass gets it correct, they will get a plus 5 for it, right? So there'll be a plus 5. And if the original team answers it correct, it's plus 10. There are no negative marks. Are you all clear with the rules, or any of you want me to tell you the rules again for round 1? They are also going to be on your screens now. Yes, can you all appreciate? Okay. So team A, we are going to start with you. Team A, are you ready, bacha? So as
Yes,
Dr.
ma'am.
Sumer said, can we have everyone else to turn off your cameras, and
Excuse me, ma'am.
only team A to turn on their cameras as well as their mics, everyone else to turn off their cameras and their mics.
Ma'am, I have a doubt, ma'am.
Yes, please tell me.
Ma'am, if some team answers it wrong, so it automatically goes to the next team. Matlab, it passes to the next team.
No, let's keep it like if they don't commit any answer. Okay.
Okay.
So if they don't commit any answer and simply say we don't know and we like to pass, only then. If they are answering something, then let's say we are not going to pass it. Yes, is that okay for everyone?
Okay, ma'am.
All right. So team A, Mayuk and Aitagni, are you ready, bacha?
Yes, ma'am.
Yes, ma'am.
All right. Great. So this is your first question. Are you able to see the question? And I'm going to read it out for you as well, but are you able to see the question?
Yes, ma'am.
Yes, ma'am.
Great. Okay. So your question is that X made the first careful and detailed description of microscopic structure of something which is Y. So you have to identify X, Y, and Z in the question. He described 9 different types of cells, including small, irregularly shaped polygonal cells without granules, which formed numerous Zellhofen, literally cell heaps, measuring 0.1 to 0.24 mm in dia throughout the gland. X refrained from making a hypothesis as to the nature and importance of these cells. In 1893, the French histologist G.E. Languis named these spots as Z. So team A, you have to tell us who or what is X, Y, and Z. Your time starts now.
ওই তো এটা কি লিউভেন হুক হবে? তোর কি লাগছে?
জেল হফম্যান বলছে যখন, এটা কি জেল বলেনের সাথে কোনো কানেকশন আছে ওই কার্সিনয়েডের সাথে বা এরকম কিছু?
Kanika and Rakesh, please keep track of the time.
লাস্টে স্পটস বলছে কেন জেড কে?
স্পটস
Yes, ma'am.
জেলব্যানন প্যাটার্ন বলছে। লিউভেন হুক তবু কি হিস্টোপ্যাথোলজিস্ট বলছে, তাহলে হচ্ছে না যে জেলব্যানন এর সাথে কোনো
You also have another hint for this question that is very much a part of the question itself, not a separate hint for you, but just a part of the question itself.
কি এটা সেরিব্রামের পার্ট লাগছে না অন্য কিছু লাগছে?
Time up, ma'am.
So time up, team A.
কি বলছিস ওইটা?
তোমার যেটা মনে হচ্ছে বলে দাও।
ওকে
So team A,
ma'am.
do you want to answer the question, bache? What or who is X, Y, and Z?
Ma'am, Purkinje cells described by Purkinje.
Is that your final answer, team A? Is that your final answer, beta?
Yes, ma'am.
All right. So unfortunately, that's incorrect, team A. Okay. And since we said if you try, we would not pass on the question. So I will just give you the answer. But not for the sake of giving you marks, but any other team wants to tell me if they have any idea who X, Y, and Z are. Anyone who wants to commit something? Okay, let me tell you. So X is Paul Langerhans. Okay, X is Paul Langerhans. Y is pancreas, and Z is the islets, the Langerhans or islets of Langerhans. Yes, what are we talking about? Insulin, yes. So pancreas and secretion of insulin. So insulin, do you know, was first described by Banting and West in 1921. Yes, and this is important because in 2021, it marks the 100 years from the discovery of insulin. Okay, chalo. So it was an interesting question. Let's go on to team B. Are you ready, team B?
Yes, ma'am.
Great. So everyone else, please turn off your mics and cameras. We're moving on to team B, Shivan and Soumya. So your question is on the screen now. Identify the scientist and mention his contribution data. Your time starts now.
Ma'am, I think Shivam is logged out. Ma'am, he is the father of radiation or radiation something intervention radiologist. Ma'am, I've forgotten his name. He's the father of intervention radiologist. Ma'am, he's something Theodore something.
Is your partner
Yes,
logged
yeah,
in again?
Login कर लिया ना?
Has your partner logged out?
No, ma'am, we are in the same room. He can come here also. Theodore something, ma'am. The scientist is Theodore and he is the father of interventional radiology. I would go for it. Charles Theodore. Theodore. Charles Theodore.
Time up, ma'am.
Time up. So now tell me the answer, bache. What do you want to say?
Ma'am, Theodore daughter and father of interventional radiology.
Okay. So it is partially correct, yes, because the name is also partially correct, but you didn't really tell me what is his contribution. Yes, so you are, as I said, partially right. The name of the person is Charles Daughter, right? And he is definitely, yes, known as the father of interventional radiology. And if you, he's particularly known for percutaneous transluminal angioplasty, right? He was one of the first person to introduce transluminal angioplasty. That is what he is known for. But yes, you're partially right. He is the father of interventional radiology and you got the name also half right. So we'll not give you +10, we'll give you +5. Okay. Team B. So our scorekeepers, Rakesh and Kanika, please ensure the team B gets +5 for this one.
5.
Yes, ma'am.
Okay. Team C, are you ready for your question, beta? So team
Yes,
C,
ma'am.
is Akash and Mukul. Perfect. All right. So this is your question. Identify the person and what is the contribution made by him. Your time starts now.
अरे पता है क्या कोई मेंटली वो तो नहीं है जो बीन से कर रहा है कुछ
नहीं मेंटली नहीं है मतलब ये कोई फिनॉल है और कोई पॉइजन है
अरे मेरे को वो दिख नहीं रहा क्वेश्चन कैसे दिख रहा क्वेश्चन नहीं दिख रहा जब तू बात कर रहा है तो
तू भी चुप हो जा मेरे को भी नहीं दिख रहा एक मिनट क्वेश्चन क्यों नहीं दिख रहा
मैम कैन यू स्पीक वंस बिकॉज़ वी कांट सी द स्क्रीन मैम कैन यू
No, you have to see the screen because it is an image hint. So it is simply identify the person and tell us the contribution made by him. Why are you not able to see the screen, beta?
अरे पिन कर ले स्क्रीन को
मैम कुछ आप बोलते हो यस मैम
मैम आप बोलते रहो मैम
Are you able to see it now?
मैम वी विल गो विद yes
probably when I speak then you are able to see it. Okay. Hanji, batao.
I'm like William Hopkins and for contribution we will say he discovered
sorry
he discovered any antibiotic ma'am no idea
okay
no idea No, I'm William Hopkins and streptomycin.
Okay, is that your final answer, bacha? Team C?
Yes, ma'am.
Okay,
Yes,
so unfortunately, that's correct. Akash and Mukul. No, that's incorrect. I'm so sorry. That's incorrect. Akash and Mukul. So actually, wo kya hai? It is a sweet clover leaf, right? The image that you see is the clover weed. And what he discovered, or who is he first? So he's Carl Paul Link. Okay, and he actually discovered dicumarol, or anticoagulant property of warfarin. So what happened was there was a cow, and the cow actually ate a lot of this sweet clover feed, and the cow died of bleeding, internal bleeding. So a sample of the blood of this cow was taken, and that's how the anticoagulant effect of sweet clover feed was discovered, and anticoagulant property of warfarin was discovered. And so that was actually dicumarol that he discovered. Yes? Okay.
Okay, ma'am.
So no marks for that one, Team C, but yes, you tried, and that's how it should be. So great going. Let's move on to Team D. Team D, Arush and Ayan. Are you ready, bacha?
Yes, ma'am.
All right.
Yes,
So great. Can everyone else please turn off their cameras as well as their mics, so that the question is only for Team D. Team D, bacha, I hope you're able to see it, and I will speak out the question for you. So X is an Indian neurosurgeon who did the first epilepsy surgery on 25th of August 1952 for right infantile hemiplegia in a 90-year-old boy at CMC Vellore, and he's called as the father of modern neurosurgery. Y is called grandfather neuron, pioneer of neurosurgery, received Padma Bhushan Award in 1972. And Z established the first EEG lab at Chennai and is regarded as pioneer of epilepsy surgery. Identify the three legends X, Y, and Z with respect to epilepsy surgery.
आरुष पता है
नहीं भाई.
Any idea?
No.
One of them is very famous.
X.
The hint for you in the question is like actually epilepsy and neurosurgery. So if you have any idea about people associated with it.
आयान कुछ भी आंसर कर दियो.
यार इंडियन है.
हाँ जी. Are we keeping track on time? Do you want to pass or you want to give some try? Ayan
Ma'am,
and
time up.
Arush? Okay. So
कुछ भी
बचा
बोल दे यार, पास मत दे आयान.
ऑथर सिंह
Time up.
पैंथल.
हाँ जी.
मैम डॉक्टर ऑथर सिंह पैंथल.
Acha. So okay, so I'm going to give you the answers. So X is Dr. Jacob Chandy. Y is Dr. Baldev Singh. Yes, he is actually who is the pioneer in epilepsy surgery, and Z-E-S-T Narasimhan. And all three of them actually work together for epilepsy. And together they are considered as the pioneers of epilepsy surgery, bacha. Yes, so those were X, Y, and Z. So, okay. We move on to Team E. Dr. Deep and Devanshi, are you ready? Can you please turn on your cameras? All right. This history-based round seems a little tough for all of you, but no worries. Let's give it a try. And there are multiple other rounds which are going to test you on different things. So Team E, this is your hint. Identify these people. Even if you give one of them right, it is okay. And please give their contribution. identify, and what is their contribution? Even if you can identify one of them, partly. What science? Team E, do you want to give it a try? Deep and Devanshi, or do you want to give it as a pass?
Ma'am, it's Watson and Crick.
Is that your final answer, Devanshi?
Yes, ma'am.
Time up, ma'am.
Okay, so time is also up and you've given your answer as well, but unfortunately that's not correct, Devanshi. So this is Sir John B. Gordon and Shinya Yamanaka. Anybody have heard of them or have a little idea what they are known for? So in 2012, they actually got a Nobel Prize for their pioneering research in nuclear transplantation and cloning. Okay, and they are the ones who actually found out that mature cells can actually be reprogrammed to become pluripotent, right? So they were given Nobel Prize for that. Yes, so team E, we don't score any marks on that. We move on to the last team. Are you ready, team F? Monita Murugan and Pragnadish?
Yes, ma'am.
Yes,
All
ma'am.
right. So we have, so sorry, just a minute. Yes. So this is your question. Identify and mention the contribution of these two. So even if you can identify one of them. Your time starts now.
Pragadish.
Idea.
Tyrosine kinase.
பேர் ஆனா தெரியல, பட் நாட் ஷுர் யாருன்னு சொல்ல தெரியல. ஸ்பெசிபிக் ரிசெப்டார்.
Receptor contribution.
Yeah, that is your hint.
ஏதோ ஒரு ஆன்சர் அதெல்லாம் சொல்லிடுறேன்.
Ma'am, no idea.
Time up, ma'am.
Okay, do you want to answer something or you want to give it as a pass?
The answer tyrosine kinase.
Okay, so no, Monita, this is not the correct answer, Bache. So he is, so one of these persons, the one with these specs is Ardim Pataputian and the other one is David Julius. So they are actually famous for identifying the receptors for temperature and touch, even pressure. So TRPM8 and piezo1 and piezo2 receptors, they are the ones who identified them, and Ardim is a known molecular biologist and a neuroscientist, right? So they are the ones. So after the end of the first clockwise round, we are still at round 1, but this time they're going to go anti-clockwise. So we're going to start with team F again. So team F, are you ready for your second question of round 1?
Yes, ma'am.
All right. So this is still going to be history based. So this is the person on your screen. I'm going to read out the question for you. X helped cholera patients during pandemic in 1832. He attempted to restore the blood to its natural state by injecting copiously into the larger intestines warm water. He introduced the term Y, which is being used in hospitals and emergency services even today. So you have to identify X and what is the Y that he found out.
அக்கா மௌனத்தக்கா, Y வந்து ட்ரையேஜா இருக்குமா? ட்ரையேஜ் எமர்ஜென்சி ட்ரையேஜ்.
X வந்து சயின்டிஸ்ட்.
X ஞாபகம் இல்ல, மறந்துச்சு.
So your biggest hint is in the first line of the question itself. X is the person, Y is something that he invented or rather introduced, not invented.
Cholera patients.
Time up, ma'am.
All right, time up, Team F. Do you want to say something about X and Y?
Is why enema, ma'am?
Why enema? No, unfortunately not. Any other team has any idea? Anyone wants to contribute?
Yes,
You can.
yes.
Yes,
Team
Deep,
E.
tell us.
Ma'am.
Tell us.
Thomas Layton, IV infusion.
Very good, Deep. Excellent. So Team E has answered, but since it wasn't a pass, Deep, you wouldn't really get the answer, but he's absolutely right. Okay, this is Thomas Latta, and Y is IV saline drip or IV infusion, as he correctly said. So very, very good, Deep. Very proud of you. And as we see, you're all warming up with round 1, and I'm really glad with that. So there are 5 more rounds to go. So Team E, Deep and Devanshin, I think you've warmed up now. Are you ready for your second question?
Yes, ma'am.
Great. All the best, bachas. Identify X and Y and their contribution. Identify Z and his contribution. Something to do with some viruses.
Time up, ma'am.
Time up, Team E. Do you want to say something, bacha? Nothing? Do you want to give it as a pass to Team D? Team E, you have to either say something or say it's a pass.
Well, is it about hepatitis?
No. That's incorrect. Okay. So now I'm going to give you the answers, but if I just give you some hint, let's see if somebody can answer. So the hint is actually HIV virus and
Loose
HPV
monitor.
virus. Yes. Who
Luke
wants to answer?
Montija.
Mukul. Yes, Mukul. Please, can you repeat your answer, bacha?
Ma'am, something Monty.
Yes.
Ma'am,
Yes.
one only I know. Monty something.
Very good, but that's very good. Yes, so X is actually Luke Montagnier and Y is Francois Sinhaus, and together X and Y, the man and the woman, they discovered the HIV virus. And Z is actually someone who discovered HPV virus. He is Harold Zur Hossen. Okay, so HIV and HPV virus, and in fact, they got the Nobel Prize in Medicine in 2018 for their discoveries. 2008, not 18. In 2008, they got the Nobel Prize in Medicine for it. Okay. Team C. No, I think we move on to Team D. Team D, Arosh and Ayan. Are you ready, bacha?
Yes, ma'am.
All right. So this is your question. Identify the scientist and his contribution beta. Chalo. So I've decided I'm going to give some hints to everybody since history round is a little tough for all of us. Something to do with vaccine.
Edward Jenner.
नहीं भाई जेनर तो नहीं है ये.
अच्छा. HPV. वो तो नहीं है साल्क एंड सेवन.
बोल दे यार भाई लग रहा है.
Time up, ma'am.
मैम साल्क एंड सेवन पोलियो वैक्सीन.
No. So Ayan, he is Maurice Hillman. He's the father of modern vaccines, and he's the one who's discovered more than 40 vaccines in modern times, right? So father of modern vaccine. But well tried, boys. So let's move on to Team C. Team C, are you ready?
Yes, ma'am.
Okay. Identify this and the contribution.
ये पता है शायद से एलेक्जेंडर फ्लेमिंग लग रहा है शायद से स्पेन का था ना कुछ तेरे को आइडिया है मुकुल
Mukul, you have to unmute beta. आप mute हुए हुए हो Mukul. Your partner can't hear you.
Ma'am, I'm saying can you give some hints like vaccine या कुछ थोड़ा बहुत तो.
सुनो तो सही, तुम्हारा दोस्त कुछ तुमसे बात कर रहा है.
मैम अलेक्जेंडर बोल रहा है मगर पहले अगर आप हिंट दे दो तो इफ इट इज गोइंग इन द राइट डायरेक्शन एटलीस्ट वी कैन नो. हिंट्स का थोड़ा तो यूज ले मैम.
मैम हिंट
मैम हिंट.
Time up, ma'am.
Time up.
मैम हिंट. मैम आप मैम प्लीज यू गॉट सम हिंट.
Do you want to say something?
मैम साइंटिस्ट इज अलेक्जेंडर फ्लेमिंग.
Okay. And the contribution?
फ्लेमिंग ने क्या एंटीबायोटिक बनाया था ना
पेनिसिलिन बनाया था ना मगर पहले ये तो क्लियर करें अलेक्जेंडर है तो फ्लेमिंग ही. मैम
अभी टाइम अप है. You have to commit. Akash.
I'm Alexander Fleming and
penicillin.
Okay, so Akash is committed and me not giving the hint was the biggest hint that he's on the right track. So well done,
Okay.
Well done Akash. Both the answers are correct. This is Sir Alexander Fleming and the discovery is penicillin. Yes. So this is actually the bullfighters memorial in Madrid. And he saved many soldiers during the war by the discovery of penicillin, right? So +10 for team C. Okay, good, well done boys. Team B, are you ready bacha?
Yes, ma'am.
All right. Identify the scientist and his golden discovery of the 20th century from 1975 to 79. He worked in cholera control for WHO in Afghanistan, Egypt and Yemen. Recently died at the age of 88 on 16/10/22. He saved lives of millions of children by his discovery.
Yes, ma'am. He discovered ORS. He is Dr. Dilip.
Okay, do you want to commit your answer?
Sure,
Lock
है ना?
कर दिया जाए?
Yes, ma'am. Okay, ma'am.
All right. So Soumya says he is Dr. Dilip and discovered ORS and he's absolutely right. So +10 marks for team B. Well done. Yes, Dr. Dilip Mahanalabis, he is the father of ORS and it is one of the most important and best discoveries of the 20th century. So well done team B. That is +10 marks. Team A, are you ready, bacha?
Yes, ma'am.
Team A. All right. So this is your question. What does this flame of hope related to and what is the theme of 2022 related to the disease?
ওইটাগনি কিছু জানিস? Flame of hope to
Flame of hope.
Ma'am, can we ask the participants to keep
Ma'am,
their
any
hands
hint?
up like
any ma'am, any clue?
I think there are lots of clue in okay, not in this one. Okay, your hint is something to do with a chronic disease, a very common chronic disease.
ওইটাগনি কিছু বুঝতে পারছিস?
Time up, ma'am.
Time up, boys. Team A, do you
Okay.
want to say something? Flame of
is it chronic? Ma'am, is the disease of okay, ma'am. ওইটাগনি তুই আছিস? Ma'am, my partner is there or not only I can't, means he is not responding.
I
Ma'am, actually I forgot to unmute myself, sorry.
আরে
Hanji.
তুই তোর কোনো ইয়ে আছে মানে তুই কিছু বুঝতে পেরেছিস?
No.
Time's up, boys. You have to commit
Ma'am,
something.
then ma'am, we are going with flame of hope as for diabetes mellitus. No.
And do you want to say something about the theme related to the disease?
Olympics. কিছু হবে?
Olympics, yeah, Flame of Hope is in Olympics actually. So, need
All
to-
right. So your answer is partially correct. Okay. So Flame of Hope is
Benti-
actually, do you know where it is
Ma'am,
located?
discovery of insulin was in 2021, so 100 means 1921, so 100 years
No, no,
completed.
no.
অ্যাথেন্স রিলেটেড কিছু হতে পারে?
So Flame of Hope, it is located in Ontario, Canada, and it actually denotes that insulin, it only manages diabetes but doesn't cure it. So November 14 is the World Diabetes Day, and the theme for 2022 is Education to Protect Tomorrow. Okay, Education to Protect Tomorrow is the theme for World Diabetes Day 2022. So I'm going to give you +5 boys for that, because you said it's related to diabetes. Okay, so we'll give you +5 for that, and with this we come to an end of round 1. So I think we've warmed up with the history, and we're going to go on to more and more clinical aspects as we go forward with the quiz. So our quiz, scorekeepers, Rakesh and Kanaka, can you update us with the score of all the teams after the end of round 1, bacha?
Yes, ma'am. Ma'am, team A is on 5.
Okay, well done, team A.
Team B is on 15.
Well done, team B.
Team C is on 10.
Well done, team C.
Team D, E and F are on 0, all 3.
So they have to open their account, and I'm sure that they would do that very soon, and they would in fact make it running. Yes. Team D, E and F, are you ready, bachas? Okay. So we're going to move on to round 2. Now round 2 is a round of reasoning. So you have to tell the why behind certain things that I'm going to ask you. Okay. The rules are that it will have not 6 questions, so not 3 cycles. We'll keep it only 2 cycles. Okay, there will be 2A, 2B, but no 2C. We are not doing the calculation part. Yes, so 2A, 2B, we will simply give it as, there is no negative marking again. And 2A, 2B, we will, if you answer all correct, we'll give it to you as +20. And this time we will change the rules of the pass. So if one team doesn't answer it correctly, it automatically gets passed to the next team, and they will get an option to answer it. Is that fair enough with everyone? Do you all agree? Can we do that with the pass? Yes?
And ma'am, does the pass continue further?
No, just once. Otherwise we have many things ruled out, right? So it doesn't continue further. It just goes to the next team, and we'll give +5. Okay. So +20 to the team who answers it correct, and +10 for the correct pass. Yes. Anyone who wants to ask the rules again, or are you okay? And can we start? Hanji,
Is there any option to pounce? Like if
No, it will be difficult. Online pouncing would be difficult, beta, to find out.
Okay, ma'am. Okay,
So
ma'am.
we'll just keep it as pass, Akash.
Okay, ma'am.
Okay. It's easier when we are face to face for pounds, but not here. Yes. Anyone else who has any doubts? Can we start?
Ma'am, koi time?
Ma'am, like if the question is for first team, then rest of the team have to keep their cameras on or not?
I think for example, if team 1, we can keep team B also, the cameras can be kept on, because we're keeping a pass in this round. So we should be able to see them what they are doing. So team A and B can keep their cameras and on.
Okay.
Mics only currently for team A, and only if it is passed on to team B. Galti se kahin team B hint na de de. Right? So team B, keep your mics off, bacha. Okay. Are you ready?
Ma'am, will there be only one question per team in this round?
No. There are more than 1 questions. Okay? There are more than 1 question.
Okay, ma'am. And you have written root word and concept. So is there
Yes.
any marking?
Sorry, if there is?
Is there any part marking? Like
We will see when it comes, right? So mostly each of the root word will have 2 questions. Okay? And what we need both the questions correct so that you get full answers. Okay? Chalo. Shuru kare? Team A, are you ready?
Yes, ma'am.
Yes, ma'am.
All right. So Team A, okay, just a minute. Just give me a minute, please.
Ma'am, is there a time limit for this? Ma'am, what is
No,
the time
we
limit?
haven't kept, but we'll see if it goes. It's okay. We'll not keep a time limit for this one. Just give me a minute, but. Okay. So, ये तो एक example है, ठीक है? But we are okay. So somebody was asking for splitting also. हम क्या करेंगे? So for example, Staphylococcus aureus है, तो we'll give you some breakups, and you have to explain the root word. And if you explain the root word correctly, you get +10. ठीक है? For example, Staphylo means bunch. Okay, coccus means berry, aureus means gold. So if you explain the root word correctly, you will get +10, Team A. And if you also answer the subsequent questions, you get another 10 marks. As I said, each will have 2 questions, so 5 and 5. So that is the split marks. That is what I was looking for. Yes? Is that clear now, Team A?
Yes, ma'am.
So 110 marks is to, identify the root word by splitting it up. And if you're able to give us the meaning of it. And the other 10 marks is for answering the questions. Yes? Are you ready?
Yes. Yes, ma'am.
All right. So this is your question, Team A. Balamuthia mandrillaris. That is your root word. Your first question is, what serious illness does it cause? And your second question is, why Balamuthia cannot be phagocytosed? So 10 marks to explain the root word and 10 marks to answer the questions.
बेलामुथिया तो नॉय
ये fresh amoeba है तो.
हाँ granulomatous
And we'll have 1 minute to answer. Otherwise, it can just go on and on. Okay. And since I
ये
told
1
the
minute
time
है
now.
तो sorry. हाँ बेला वही तक नहीं बेलामुथिया तो তাহলে ये encephalitis হচ্ছে তাই তো?
হ্যাঁ encephalitis
brain eating anemia তো হচ্ছে ये এতে
কিন্তু এই রুট ওয়ার্ডটা কি স্প্লিটিং বুঝতে পারছি না
বেলা না what serious illness does it cause ওটা করতে হবে
হ্যাঁ সিরিয়াস ইলনেসটা তো why বেলামুথিয়া cannot be phagocytosed তো এরকম কিছু হতে পারে যে ওটা অ্যান্টিফ্যাগোসাইটিক কিছু রিলিজ করে বা ওটা স্ট্রাকচারে
antibody variation antigenic variation হতে পারে সিরিয়াস ডিজিজ কি কজ করে ইয়ে এনসেফালাইটিস তো করবে আমাদের মনে হচ্ছে ব্রেন ইটিং অ্যামিবা হচ্ছে আর ইয়ে কি জন্য হতে পারে
আচ্ছা এনসেফালাইটিস করবে না মেনিনজাইটিস করবে কোনটা বল
ব্রেন ইটিং অ্যামিবার মধ্যে পড়ছে তো ফ্রেশ ওয়াটার ইয়েতে ব্রেন ইটিং অ্যামিবা
আমার তো এনকেফালাইটিস মনে
টাইম আপ ম্যাম
এনকেফালাইটিস
1 minute up, Rakesh.
Yes, ma'am.
All right, boys. So let me ask you one by one. First, are you going to split and explain us the word Balamuthia mandrillaris, because that is your root word, and 10 marks are for splitting and explaining. If not, then you can start answering the questions that follow. What serious illness does it cause, and why it cannot be phagocytosed?
Ma'am, serious illness is granulomatous amoebic encephalitis. Cannot be
phagocytosed because it displays antigenic variation. And Balamuthia is coming. It is a fresh living amoeba, freshwater amoeba. So Balamuthia means a large size, maybe Balamuthia. Ma'am, we are going with encephalitis and antigenic variation to prevent phagocytosis.
All right. So what we are going to do is we are going to give you only partially correct marks. And let me explain what marks I'll give you. So first, Balamuthia mandrillaris. Okay. So Balamuthia is coming from the word William Balamuth. Okay. From the person who discovered it. Mandrillaris is from mandrill monkey, where the disease was first identified. I'm going to give you +5 for correct disease that it causes. So granulomatous amoebic encephalitis is correct, beta. But why it cannot be phagocytosed is because it is larger than the leukocytes. Okay, so it's larger than the leukocytes and therefore cannot be phagocytosed. You were right, it is a free living amoeba, but that wasn't the question. Okay, so team A, you get only 5 marks, beta, for answering one thing correctly. Okay, so scorekeepers, 5 marks for team A. So team A,
Yes.
you can turn off your cameras and mics, bacha. Team B, are you ready for yours?
Excuse me,
Yes,
ma'am.
ma'am.
Hanji.
Excuse me, ma'am. Ma'am,
Yes, yes.
why wasn't it passed? Like they said only one answer correct, right? So
Yes,
बाकी
they
बचे हुए
answered
options.
one. So the thing is, because they answered one correct, it gives a lot of hint for the other things also. Okay, so that is
Okay.
why we are not passing it. If they don't answer anything, then it is fair to pass it on. Yes, so that is why it wasn't passed and I gave the answer. Okay, team B, are you ready?
Yes, ma'am.
Okay, just give me. Just a minute, huh? Okay. Team B, herpes zoster. Okay.
देख
Name the first
जो
drug of choice for post-herpetic neuralgia. And your second question is, herpes zoster lesions in the tip of nose is associated with herpes keratitis. Why? Team B and Team C.
देख टिप ऑफ नोज वाला वो हचिंसन साइन है फर्स्ट वाला तुम्हारा वो ठीक है वो मैं कर लूंगा ठीक है 1 वाला सही 2 सही है 1 क्या बता रहा है तू गाबापेंटिन प्रीगैबलिन में से कोई ठीक है कर लेते हैं गाबापेंटिन प्रीगैबलिन दोनों ही हो जाता है वैसे और हर्पीज जोस्टर का क्या बताएगा तू हर्पीज यानी कि वेसिकुलर वाला कुछ जोस्टर को शिंगल से कुछ या फिर हर्पीज को कुछ भी वेसिकल से कुछ है मीनिंग कुछ हर्पीज का हर्पीज को मेंटल वर्ड क्या है यार ऐसे पता नहीं मेरे को तो नहीं पता पाएंगे जोस्टर मैम डज इट स्टैंड फॉर शिंगल्स और समथिंग लाइक
So you have to tell me, are you ready to answer all the questions? You still have some time left if you
देख
want
अभी
to think.
समय है देख जोस्टर क्या हो सकता है हर्पीज क्या हो सकता है उसके बारे में सोच एक बार जोस्टर में वो बोल दें कि जो रिकर करता है डर्माटोम रेकर वेसिकुलर कुछ तो हो सकता है ना डर्माटोम भी हो सकता है रेकर भी हो सकता है फर्स्ट ड्रग कौन सा रखना है गाबापेंटिन रखना है प्रीगैबलिन रखना है दोनों ही हो जाए कोई दिक्कत नहीं मैम सो
Time up, boys.
बोल देना
Team B. So first, are you going to explain herpes zoster? Your root word?
Yes, ma'am. Herpes zoster, ma'am, will go for the painful rash or something blisters or vesicles. We would go for those keywords, ma'am.
Okay,
for the
and
drug,
you want to answer the first question, name the drug of choice for post-herpetic neuralgia.
ma'am, for post-herpetic neuralgia, we would like to go for gabapentin or pregabalin.
Okay,
and second, this is Hutchinson's rule. If the tip of the nose is involved, ophthalmic branch उससे पहले involve हो जाएगा, so that will also cause herpetic keratitis too.
All right, boys. So you haven't explained your root word correctly, so I'm going to do that for you. So herpes means herpine, to creep, okay? And zoster actually means a girdle or a belt. So it's creeping lesions along a nerve root distribution, right? And you're right with the drug of choice, so gabapentin or pregabalin, so you get +5 for that. I will also give you +5 for correctly explaining, although again it has.
Ma'am, the nerve is not mentioned.
It's okay, but they had they have the right cause. They gave the sign.
Ma'am, I told that ophthalmic branch of the mandibular.
कोई बात नहीं. Ophthalmic division of the trigeminal nerve. Yes, it also.
Ma'am, I told you it supplies the tip of.
Yeah, so a branch of it supplies the tip of nose, and it also supplies the innervates the cornea. So that is what is the Hutchinson sign. So I'm going to give you +10. Team B for this, correctly answering the questions. So our scorekeepers, Team B gets +10.
10.
Team C, Bacha, Akash and Mukul, are you ready?
Yes,
Yes,
ma'am.
ma'am.
All right. So your root word is schizophrenia. Your first question is, what is the most common delusion in it? And your second question is, a patient with schizophrenia is asked about his father's health. He answers, it's not good. He smokes cigarettes. I warned him about that in his apartment. I used drugs there once. I saw a hole in the carpeting and thought bugs were coming out. Explain this phenomena. Your time starts now.
देख शिज़ोफ्रेनिया का शिज़ो का मतलब होता है स्प्लिट फ्रेनिया का
स्प्लिट माइंड
हाँ फ्रेनिया डिक्रीज्ड मतलब माइंड स्प्लिट माइंड से ही हो गया मोस्ट कॉमन डिल्यूजन तो डिल्यूजन ऑफ परसिक्यूशन ही होता है शायद से
हाँ डिल्यूजन ऑफ परसिक्यूशन है सही है
और ये फिनोमेना का क्या है मतलब इसने करेक्ट आंसर नहीं दिया मतलब ये दूर चला गया या तो ये टेंजेंशियलिटी लग रहा है मुझे
कि टेंजेंशियलिटी में तो लास्ट में आ जाता है ना मतलब घूम फिर के या दूर चले जाता
नहीं
है
वो सर्कमस्टेंशियलिटी टेंजेंशियलिटी मतलब देखना सर्कल के इधर से वो निकल गया टेंजेंट चला गया तो टेंजेंशियलिटी आई थिंक मेरे को याद आ रहा है तू बता
I saw a hole in the carpeting. Patient से पूछा क्या what is your what his father's
health कुछ
हाँ
भी
उसने
बोला
लास्ट तक ये बताया नहीं कि हेल्थ
हाँ।
का हाँ मतलब
टेंजेंशियलिटी
ठीक है टेंजेंशियलिटी ठीक है परसिक्यूशन स्प्लिट माइंड और
स्प्लिट माइंड डिल्यूजन ऑफ परसिक्यूशन और टेंजेंशियलिटी
हाँ बिल्कुल मगर हाँ ठीक है थॉट बग्स से कोई रिलेटेड नहीं है परसिक्यू ये पक्का मोस्ट कॉमन वही है ना
टाइम अप मैम
हाँ वही होता है
Time up,
हाँ,
boys. Team C,
All the
Akash and Mukul. Do you want to commit your answer, bacha?
यस मैम
yes ma'am
हाँ जी,
मैम
बताओ.
schizophrenia मैम like split mind most common delusion is delusion of persecution and ma'am in this phenomena is showing tangentiality because the patient is not answering what has asked he's going like tangent phenomena so it is tangentiality.
Okay. I am very, very happy to say that Akash, you've answered all the things very correctly. And I also love the approach, your approach to the question. So wonderful. Yes. So shizu means split, phrenia means mind. And the most common delusion is delusion of persecution. And the phenomena is tangentiality. The only place where I want to correct you a little, Akash, is when the person is asked about the question, beta, वो शुरुआत सही करता है. He starts logically, but then deviates more and more away from the topic that is being asked. But yes, you were very, very right. So a big round of applause for Team C. Very well done. So you get plus 20 Team C. Excellent. All right, Team D. Bacha, are you ready? Team D?
Yes, ma'am.
Great, boys. So your root word is corpus callosum. Okay, your root word is corpus callosum. Your first question is, what is the thickest part of the corpus callosum? And in a patient with corpus callosum agenesis, if an object is felt by the right hand, he can name it. Whereas if it is placed in the left hand, he cannot name it. Can you explain the mechanism? Your time starts now, boys.
और उस कॉर्पस मतलब बॉडी और थिकेस्ट पार्ट क्या होता है स्प्लीनियम और सेकंड में वो क्या होता है
कनेक्शन नहीं है ना दो सेरिब्रम के बीच में तो वो
हाँ,
लर्न नहीं कर पाया तो उसको क्या बोलते हैं वो कौन से फाइबर्स होते हैं एसोसिएशन होता है प्रोजेक्शन होता है और तीसरे कौन से फाइबर्स होते हैं
आर्गुएट एसोसिएशन प्रोजेक्शन
कॉमिशरल फाइबर्स हाँ
हाँ
तो यहाँ पे कॉमिशरल फाइबर्स नहीं होंगे तो दोनों हेमिस्फीयर्स के बीच में वो सीख नहीं पाया या कनेक्शन हो नहीं रहा मतलब जिस हेमिस्फीयर में उसकी मेमोरी है और दूसरे हेमिस्फीयर में वो टच ले रहा है तो वहां
उधर से हाँ दूसरी साइड जा नहीं पा रहा
थिकेस्ट पार्ट यार कॉर्पस बॉडी कैलोजम कैलोजम
कैलस क्या होता है
कैलस क्या होता है कैलस
ग्रोथ कनेक्शन
बॉडी से कनेक्शन हाँ
All right, Team D, bachas, time is up. Do you want to commit your answers? Ayan and Arush?
आयान उसका स्प्लेनियम ही बोलना है
हाँ स्प्लेनियम बोलते हैं
ठीक है तो मैम कॉर्पस इज बॉडी कैलोजम इज अ कनेक्शन So connection between the two hemispheres of the cerebrum, which acts as a connection with the body, thickest part is the splenium. And because why he's not able to identify, because the connection between the two hemispheres is not there, the commissural fibers. So touch on one hand will not result in memory connection with the other hemisphere. So yeah.
All right, boys. So partially correct. So I'll tell you where you just went wrong a little. So corpus means body. Callosum, आप लोग actually बहुत सही सोच रहे थे, फिर थोड़ा सा deviate हो गए कि growth होता है, and it actually means hard growth. So corpus callosum, okay, body and hard. And you're right, absolutely right. Ki splenium is the thickest part, so very good. And you've also given a good explanation on the why. So basically क्या होता है, both hemispheres, हमारे जो दोनों hemispheres हैं, they can process the sensory input beta. But naming तभी हो सकता है if it is from the dominant. That is why when you place it, you know, in the left hemisphere, जब आएगा तभी वो नेम कर पा रहा है. तो राइट हैंड में रखोगे तभी वो नेम कर पा रहा है, whereas in the left hand he is not able to name it. So I'm going to give you out of 10 5 marks for telling the root word correctly, since you gave corpus correct, and for both the questions I'll give you +5 and +5, so you get a total of 15 marks. Team D, so proud of you, very good, you've opened your scorecard and I'm sure you are going to rise from here. So well done, boys. Team E, bacha, are you ready? So our scorekeepers +15 for Team D.
Yes, ma'am.
Okay, Team E, are you ready, bacha? All right, I can't hear you. Both of you have to unmute. Great.
Yes, ma'am.
So your root word is decusation. Explain the root word and why it is named so. The second is all retinal cells are depolarizing in dark and hyperpolarizing in light, except one cell which is always depolarized. What is the name of that cell? The time starts now.
Road cell wants to accept.
Time up, ma'am.
Time up. Team E, can you please answer?
Decusation means crossing fibers and
Sorry, I didn't hear your second answer.
ganglion.
Okay. So I'm going to give you only some marks for this because it is only a partially correct answer. So it was very simple. You have to, you know, divide the word into two parts and then explain. Why couldn't you do that? What does the word deca mean? Decusate. What is deca? 10. Okay.
10.
So deca actually means 10. And it is named like that because it resembles the Roman symbol for 10, X.
10.
And X, yes, as you said correctly, it means crossing over. That is why it is named like that.
Yeah.
So I am not going to give you any marks for splitting the word and giving the answer, but I'm going to give you the marks for explaining the crossing over part. So you get +5 for that. And the cells are also not correct, Beche.
Correct.
They're called as amacrine cells. Okay. The amacrine cells are the always depolarizing cells. They use acetylcholine. Okay, so +5 for Team E, but I'm glad you've opened your scorecard and I'm sure you're going to do well in the future rounds, bache. All the best.
Thank you,
Team
ma'am.
F, are you ready, Team F?
Yes, ma'am.
All right. So your root word is ultimum moriens. And you have to tell us etymology of ultimum moriens with respect to neurology. You know, what is it? And you have to tell us the new drug sodium phenyl butyrate or torurosodiol is approved for which neurological disorder? Your time starts now.
Pragadish? Pragadish?
கேக்குது அல்டிமேட் மாரியன்ஸ்னா பாடி அல்டிமம்
Moriens. நியூரலாஜிக்கல் டிசீஸ் ரிலேட் பண்ணதா?
ஆமா.
அந்த ட்ரக் மீனிங் தெரியுமா?
ஷூர் அல்ல. அல்டிமேட் பாடி what is it?
நியூரலாஜிக்கல் டிசீஸ்.
மேனியாவா? மேனியா
இல்ல நியூரலாஜிக்கல் டிசீஸ். நியூரலாஜிக்கல் டிசீஸ்.
மேனியா
Time up, ma'am.
All right. Team E. No, sorry. Team F. Your time is up. Do you want to commit something, bacha?
Ultimate body.
Something related to amylotropic lateral
amylotropic lateral sclerosis.
Okay. Any other answer that you want to give? You haven't given me the splitting of the word.
Ultimate body.
Okay.
And
the second question?
Second sub-question is amylotropic lateral sclerosis.
No. Okay. So I'm going to give you partial marks for this one. What does ultimum means? Ultimum means final, na? Final or late, right? So ultimum means late and moriens means death. Okay. So this is actually the last muscles which are going to be affected. Yes. So with respect to ALS. So that is what is the significance in neurology with respect to the word. So you didn't give me the splitting correct. So ultimate was late, moriens is death. That is so late. And with respect to neurology, it is the last muscles to be involved in ALS. Do you know what are the last muscles? So, or we can say they're usually spared and they will be affected last, finally leading to death. So they're like serratus, triceps, lower part of latissimus dorsi, right? So they are the last ones to be affected. Yes, you answered the second question correctly. It is the new antioxidant drug for amyotrophic lateral sclerosis. So I'm going to give you +5 for answering one of the questions correctly, Team F, right? So you've opened your scorecard. All the best for the future rounds, and I'm sure you're going to do well. So +5 for Team F scorekeepers.
Yes, ma'am.
Okay, so
Excuse
now
me,
yes, Hanji.
Ma'am, can I ask a question?
Yeah, please.
In corpus callosum, we had body and heart. What does that have anything to do with the brain and all? Does it make any sense, body and heart?
Body and heart, maybe it is the a harder part of the brain. I'll have to look it up myself. Maybe we will ask Dr. Sumer about it if he has knowledge, but maybe it is one of the harder parts. Not really sure, but yes, that is the split of the word. I'm sure it will have some meaning, so give me some time. I'll find it out for you and get back to you with that one. And this becomes very interesting. So the quiz masters are being bombarded with some questions which they will figure out the answers of. So thank you for giving me that question, and I'm going to find out the answer for you. But till then, we're going to move on with, again, Team F, because we're going to go anti-clockwise. Team F, are you ready? So the second part of round 2 is also going to be about concepts. Okay, so we are going to ask you why behind certain things, and you have to tell us the answer. Okay, are you ready?
Yes, ma'am.
Yes, ma'am.
Okay. So your question.
The upper part of the screen is not visible, ma'am.
Yeah, I will speak it out for you. It's getting a little cut from there. So the question is, though crate and cobra venom are neurotoxic with similar presentations, reversal of symptoms with treatment is delayed in crate when compared to cobra. Why? Do you want me to repeat?
Yes, ma'am, it's understood. Ma'am, in crate it is post-synaptic and like cobra it is pre-synaptic action of the toxin, ma'am. So there is delayed response in crate.
Anything else you want to add to it?
Ma'am, can you show the entire question, ma'am?
Though crate and cobra venom are neurotoxic with similar presentations, okay, reversal of symptoms with treatment is delayed in crate compared to cobra. Why?
Ma'am, because of presynaptic and postsynaptic, ma'am. Action of toxins is presynaptic, so it is delayed, ma'am.
Okay.
Sorry, postsynaptic, so it's delayed, and usually crate bite is painless, so it is lately detected. That usually they will be found unconscious.
Okay. Is that your final answer? Should I lock it?
Yes, ma'am.
All right. So I think I'm going to give you marks for that one. So you are right. So the concept is absolutely right. That crate toxin, okay, do you know the name? It's called as Bungaro toxin. Okay,
Yes,
Bungaro toxin. And you said, right, that it acts pre-synaptically, whereas for cobra, it is going to act post-synaptically. Yes. Do you know, okay, just for knowledge sake, and we have to learn something when we go, do you know what neurotransmitters are we talking about when we talk about crate and when we talk about cobra?
Acetylcholine, maybe.
Yes, yes. So you're right. So it is inhibition of acetylcholine release in crate, which is pre-synaptically, and cobra.
Cobra.
It causes competitive inhibition of nicotinic receptors. Okay, so that is how it acts, and it can be reversed with the help of which drug?
Neostigmine.
Yes, excellent. Very well done. Very well done, Team F. I am very proud of you. So a full 20 marks for you on this one. So good concepts, and whys are becoming more and more important, not only, now in the quiz, but also in your upcoming exams. The questions are more going towards whys and concepts and application of concepts. So well done, Bacha. Very proud of you. Team E, are you ready now?
Yes, ma'am.
Okay. So Team E, your question is, can you explain central pontine myelinosis? Can you explain central pontine myelinosis? Your time starts now. Something we all have to know. It's very important for us. Yes, we've all read about it as well.
Hyponatremia. Rapid rising, rapid rising sodium. Rapid rising sodium pull out the water, pull from brain cell, and that leads to due to sodium concentration accumulation, the water from the brain cell is coming out. That leads to central pontine myelinosis.
Okay, I need some more explanation from your part. Okay, so I'm going to ask you, and then if you can answer, because what you're answering is a small part of it. Yes. So when we talk about central pontine myelinosis, hota kisme hai wo? So can you tell me, you would see this in patients who have hyponatremia. Yeah. So can you tell me?
Sodium.
So can you first tell me what is actually happening because of hyponatremia, and then we move on to correction, which is what you are talking about.
Hyponatremia is
So you tell me whether you can answer this or not, and then I go forward. All right, let's forget this part. Now you were talking, now we move on to the second part. Okay, so I'm going to give you the first part. So what happens is, when there is a chronic hyponatremia, the nerves undergo a compensatory mechanism. What does it do? It pushes the intracellular osmolytes to the extracellular compartment. So that is what is happening in a state of hyponatremia, and this is to maintain the isoosmolality. Now, when you start correcting, we should ideally be doing a gradual correction. Yes. So now you were talking about something. If you do rapid correction, what is going to happen, bacha? Batao.
वाटर जो pull out हो जाएगा brain cell से.
So when you do a rapid correction, what is going to happen? There is a sudden increase in the osmolality. Yes. And this is what is going to cause a cellular dehydration. Okay. Yes. So then what happens? Why is it called as central pontine myelinosis? In medical science, most of the times the word itself gives you some part of the answer.
नर्व से कवरिंग होता है ना, वो प्रोटेक्ट करता है ना, उसको डैमेज हो जाएगा माइलिन से इसको.
All right, perfect. Yes, so dehydration would typically affect the myelin forming oligodendrocytes. All right. And it also leads to disruption of the blood-brain barrier. Yes. So what I'm going to do, beta, I'm not going to give you a full 20 marks for this one, but a plus 10 for this. Yes, because you could talk about, yes, that we should not be doing a rapid correction, but what is actually happening in central pontine myelinosis, or why rapid correction would cause something, was not properly answered. So is it okay if I give plus 10? Yes, I don't want to be a diminish score, quiz master. So plus 10 for team E. Team D, are you ready, bacha?
Yes, ma'am.
All right. Okay. So your question is, what is the mechanism behind using vitamin C in HAT therapy in septic shock in ICU setting in optimal doses? I'll repeat. What is the mechanism behind using vitamin C in HAT therapy in septic shock in ICU setting in the optimal doses?
Ayan?
Ayan, are you there? Where is he?
नहीं है ma'am.
Kanika, can you please check if Ayan has logged out by mistake?
Yeah, ma'am, I'm checking.
Okay. Arush, till then, maybe you can think aloud.
Ma'am, is the timer going on?
They must have started the timer.
Yes, ma'am.
अच्छा, एक बारी उसको phone लगाओ. Let's call up Ayan and ask him where he is. It's okay. I'll give you some extra time, Arush. But maybe you can start thinking about it. Arush, do you want to say something?
Ma'am, I've never heard of it. I need some priming to at least begin a thought process, but he's not here, so.
Okay. Ayan, have you finally joined back?
Yes.
Okay, Ayan, so very quickly, I'm going to speak out the question for you, bacha. Okay.
Yes,
what is the mechanism behind using vitamin C in HAT therapy in septic shock in an ICU setting in optimal doses?
Ayan है आइडिया?
नहीं यार.
देख गलत बोला तो सी पे जाएगा क्वेश्चन.
हाँ बता.
तो कुछ लॉजिक देख, जेम्स लिंड जब शिप में दे रहा है इनको.
हाँ.
तो लॉजिकली विटामिन सी भाई कैपिलरी फ्रेजिलिटी वगैरह का होगा.
हाँ वो इस कर्वी से रिलेटेड है.
हाँ तो सेप्टिक शॉक
कोलेजन
अल्टीमेटली डेथ तो डीआईसी वगैरह से ही होगी.
सेप्टिक शॉक में कैसे यूज करेगा?
वही मैं सोचने की कोशिश कर रहा हूँ. विटामिन सी का एक्शन पे जा, नहीं तो विटामिन सी के डिजीजेस पे सोचेंगे.
एंटीऑक्सीडेंट होता है विटामिन सी?
सेप्टिक शॉक में क्या करेंगे उस एंटीऑक्सीडेंट एक्शन
अच्छा,
का?
हाँ।
ऑक्सीडेंट्स थोड़ी बढ़ जाएंगे सेप्टिक शॉक में।
कोलेजन और
या तो हाइड्रोकोर्टिसोन वगैरह की सेंसिटिविटी से रिलेटेड कुछ होगा कि उसकी सेंसिटिविटी बढ़ा देता है, लेकिन वो भी लॉजिकल रीजनिंग नहीं है। मे बी कैपिलरी फ्रेजिलिटी इंप्रूव कर देता है।
मेरे को वही लग रहा है, कैपिलरी फ्रेजिलिटी वाला। सेप्टिक शॉक में परमिबिलिटी बढ़ जाती है ना कैपिलरी की, तो
हाँ हाँ बिल्कुल,
उसको प्रिवेंट
एपिथेलियल
करने के लिए।
रीजनरेशन वगैरह, एंडोथेलियल रीजनरेशन वगैरह।
हाँ हाँ, वही बोल रहे हैं।
मैम समथिंग टू डू विद द एंडोथेलियल, मतलब कैपिलरी फ्रेजिलिटी, so it
कैपिलरी फ्रेजिलिटी,
it decreases the plasma leakage, so
it prevents short.
Ma'am, now the time.
so probably protects the hematocrit and all, मतलब it prevents it from falling, the patient going into DIC, internal bleeding and all.
Okay. Is that your final answer? Are you committing your answer?
Yeah.
Okay. Rosh, it is not the correct explanation, bache. So maybe let's see if you've heard about this. So vitamin C basically ascorbic acid, तभी उसका पूरा नाम भी दिया था नीचे. So you actually give hydrocortisone, ascorbic acid, thiamine देते हैं. So ascorbic acid जो है, it is actually a cofactor for dopamine beta hydroxylase and tyrosine hydroxylase. And so they help in synthesizing endogenous dopamine, norepinephrine. So ये क्या है? Endogenous vasopressors. Okay, so these are like endogenous vasopressors, and that is why they're helpful in septic shock. But the key thing, bacha, is that you have to give it in only optimal doses, which is like 2.5 to 10 milligrams, grams, not more than that, because more than that becomes harmful. You were right about hydrocortisone, though, that it suppresses the oxidative stress and pro-inflammatory cytokines, but not about the ascorbic acid part. So unfortunately, I will not be able to give you marks on this one, Team D. Okay? All right. Team C, are you ready?
Yes, ma'am.
Yes,
All right. So Team C, your question is, antibiotic therapy is not recommended during bloody diarrhea phase of E. coli infection to prevent hemolytic uremic syndrome, while it is always preferred in pneumococcus associated HUS. Can you explain why, beta?
अरे सुन, इसके अंदर टॉक्सिन एसोसिएटेड है इसलिए।
मतलब मैकेनिज्म कराने का जो तरीका है वही अलग है।
हाँ, वो टॉक्सिन से हो रहा है।
न्यूमोकोकस टॉक्सिन से नहीं करवाता, तो हम एंटीबायोटिक मतलब टॉक्सिन वाले में नहीं देंगे और इस वाले में देंगे न्यूमोकोकस, क्योंकि न्यूमोकोकस खुद ही करवाता है, मतलब तो अटैक उस पे करेगा। एंड मतलब जो टॉक्सिक वाला है, एंटीबायोटिक तो उस पे काम ही नहीं करेगा, एंटीबायोटिक तो ऑर्गेनिज्म के अगेंस्ट काम करेगा, उसके टॉक्सिन पे वाले फेज पे तो नहीं करेगा।
हाँ बोल। चल इस और कुछ रुक जा, एक बार सोच ले ना, ऐसे 1 मिनट है।
Pneumococcus associated HUS or diarrhea, bloody diarrhea, enterotox is not recommended. हाँ मतलब और क्या होगा?
हाँ यार, मेरे को भी लग रहा है टॉक्सिन वाला इससे चलेगा।
टाइम अप मैम।
बोल दे।
I'm like both of the organism are causing bloody diarrhea, but the mechanism are entirely different. Like enterotoxigenic E. coli, the mechanism of causing bloody diarrhea is due to its toxins, like toxin A and B, and pneumococcus associated HUS is like basically by the whole organism, not by toxin mediated. So like if we have to give antibiotic, it will be given in the whole organism case, like in pneumococcus one, not in the enterotoxigenic case.
Okay, so it is, I think, somewhat correct, but not absolutely correct. So what happens is, see, when you talk about pneumococcus associated HUS, it coexists with invasive disease, right? So when it coexists with invasive disease, usse kya hota hai? When the hemolytic episode is triggered, it is also released, neuraminidase is released from the bacteria, and that is going to cause increase in the hemolysis. Right. So because it is associated with invasive disease, you are also giving what? And as you said, because the entire organism itself is affected. Yes, whereas it is not really helpful in E. coli associated hemolytic uremic syndrome. In fact, it actually increases the risk of the toxin being released in more severe disease. All right, but I somewhat feel that it is partially correct. Okay, not absolutely correct. So I'll give you plus 10 on that. Okay, instead of plus 20 team C. Yes, so a plus 10 for team C, because although yes, the gross things you said were right, but
Yes, ma'am.
but the correct explanation is not there. So we'll give you plus 10 on that. Okay.
Ma'am, 15.
There is no negotiation, huh? Chalo, no badmashi. Okay, team B, are you ready?
Yes, ma'am.
All right, bacha. So your question is, in a patient with myxedema coma, patient should be first started on loading dose of hydrocortisone, followed by parenteral levothyroxine. Why?
Because thyroxine will metabolize the remaining hydrocortisone and it will worsen the myxedema.
वर्सन कर देगा वो.
हाँ, और कमी कर देगा ना वो. अगर थायरोक्सिन मेटाबोलाइज कर देगा बाकी का जो हाइड्रोकॉर्टिसोन है, इससे पहले तुम पहले हाइड्रोकॉर्टिसोन देते हो ताकि एक लेवल बन जाए, फिर तुम थायरोक्सिन देते हो, क्योंकि थायरोक्सिन बीएमआर बढ़ाता है ना.
ठीक है, और कोई पॉसिबल एक्सप्लेनेशन?
और क्या हो सकता है?
ये पक्की बात है ना सर?
हाँ हाँ, बाकी तो ठीक ही है.
कुछ है क्या कि पोटेंशिएशन वगैरह कोई किसी का कराते हैं ऐसा टाइप का?
पोटेंशिएशन का तो मेरे को नहीं पता, बट शायद करा, बिकॉज थायराइड भी इंटरन्यूक्लियर है और कॉर्टिसोन भी मतलब इंटरन्यूक्लियर तो कर सकते हैं. ठीक है ना?
अभी टाइम है, सोच रहा हूं. क्वेश्चन वही है ना कि फर्स्ट उन्होंने लोडिंग डोज ऑफ आईपीजी है, उसके बाद कर दिया.
टाइम अप मैम.
All right, time up.
So
team
ma'am,
B.
so yeah ma'am, the levothyroxine will cause if we give levothyroxine before giving hydrocortisone, so what the levothyroxine will cause metabolism of the remaining hydrocortisone that was initially in the body, and it will further decrease the levels. So first we give hydrocortisone so that the amount of steroids is maintained, and then we give levothyroxine. Because thyroxine increases the BMR and metabolism.
Okay, so you have almost given me the correct answer, although broken, but ठीक है, सही है. So देखते हैं. देखो, तुमने बोला कि we should give hydrocortisone first, and the reason पहले नहीं बोला था लेकिन बाद में बोला, so I agree. So what will happen? Basically, what is happening is when there is severe hypothyroidism, there is also a adrenal reserve is decreased, which is because of panhypopituitarism, right? So the adrenal reserve is already low. So अगर आप पहले thyroxine दोगे, it will increase the BMR, which you said later, and that will increase the need for steroids, causing a precipitation of what? Adrenal crisis.
Adrenal crisis.
Yeah, so you want to basically prevent the development of Addisonian crisis. So you first give hydrocortisone and then you replace, levothyroxine. So I think you gave me all the keywords which were required. So I'll give you plus 20 for this. Although the sequence of answering was upar niche, but you gave me the keywords. You gave me BMR. You gave me that the levels of steroids are low, which means the adrenal is already has a low reserve. So you gave me all the keywords required. Yes. So सिर्फ उनकी articulation में problem था, but I'll give you full marks for that because that's not an English class, it's a medicine class, right? So plus 20 for you for that one. Well done, team B. Okay, team A, are you ready? Team A, are you ready, bacha?
Yes, ma'am.
Okay. So your question is, in carbon monoxide poisoning, the patient is not tachypnic and directly presents with altered sensorium and coma. Why?
ওইটাকে তোর কি মনে হচ্ছে অল্টারড সেন্সোরিয়াম এন্ড কোমাতে আসছে ফার্স্টে? কার্বন মনোক্সাইড পয়জনিং এটা কার্বন মনোক্সাইড হচ্ছে না যে কমপ্লেক্স 4 কে ইনহিবিট করছে, এটিপি সিনথেস কমপ্লেক্স কে ইনহিবিট করছে, তাই জন্য এটিপি হচ্ছে না. আরে ওইটাগনি মাইকটা অন কর. হ্যালো ওইটাগনি মাইকটা অন কর.
হ্যালো
মাইক. হ্যাঁ, তো কার্বন মনোক্সাইড পয়জনিং এতে হচ্ছে না যে ফার্স্ট এতে তো হচ্ছে ইয়ে প্রোটিন মানে এটিপি জেনারেশনটা কমে যাচ্ছে, তার জন্য একটা কোমা হতে পারে। এটিপি জেনারেশনটা কমে যাচ্ছে, ট্যাকিপনিয়ার আগেতে হচ্ছে, তো তাহলে এটিপি জেনারেশনটা কমে যাওয়ার জন্য হতে পারে নাকি? তোর কি মনে হচ্ছে?
আর ব্লাড ব্রেন ব্যারিয়ার ব্রেন লেভেল থেকে
এটা সলিউবল তো সব গ্যাসই হচ্ছে, কারণ মনে হচ্ছে।
soluble তো।
আর কিছু মনে হচ্ছে? কজেস কোমা বিফোর ট্যাকিপনিয়া, আর ইয়েকে স্টিমুলেট করছে
আমার
না।
মনে হচ্ছে
ওর
brain এর যে
ক্যারোটিড আর
receptor-
অ্যাওটিক,
হ্যাঁ ওই
হ্যাঁ
receptor
ওইগুলোকে
level এ
স্টিমুলেট
কিছু-
করছে না, কারণ কি আমাদের হাইপক্সিয়াতে হয়, কার্বন মনোক্সাইডেতে হাইপক্সিয়া ইয়ে হয় না।
টাইম আপ।
হ্যাঁ
বলে দাও,
Time
তুমি
up, boys.
তুমি যে পয়েন্ট গুলো
Team A.
বলেছো প্রত্যেকটা বলে দাও।
হ্যাঁ ম্যাম, ইন কার্বন মনোক্সাইড পয়জনিং, ma'am, there is actually our brain responds to the receptors, carotid and aortic body. So in carbon monoxide poisoning, the free oxygen level or the hydrogen level is not changing. So there won't be a tachypnea at first, but there is altered sensorium and coma because in the brain cells, carbon monoxide inhibits the complex 4 of protein synthesis. So ATP depletion is there. So it could lead to coma because lack of neurotransmitter
Oxidative
means
phosphorus.
neurotransmitter release requires some energy also.
Okay,
So we are going
boys.
for
So boys are trying to explain it to me like you know, I am a little girl and trying to understand. So very well done. The easier you were trying to make it easy for me to understand what you're trying to say, and that is the benchmark of a good student and a good teacher as well. So I will give you full marks on that one. So you were right. So what happens is in carbon monoxide poisoning, mein PO2 and oxygen saturation are normal. And as a result of which you very correctly said, the chemoreceptors will not get activated, right? So there is no feedback to the brain to increase respiratory rate. So tachypnea will not be there. But what will happen? It will directly affect the brain. So actually brain starts getting affected first. So there is hypoxemia and hypoxia in the brain. So very well done. I'm going to give you plus 20 for that, team A. Well done, boys. And with that, we come to an end of round 2. So our scorekeepers, can you help us with the scores at the end of round 2, bache?
Yes, ma'am. Ma'am, team A is on 30.
Okay, well done, team A.
Team B is on 45.
Well done, team B.
Team C is on 40.
Well done, team C. So a close marks between A, B, C. Okay.
Yes, ma'am. Team D is on 15. 1-5.
Well done, team D. Buck up, boys.
Team E is also on a 1-5-15.
Very good. So again, close match between D and E.
And team F leading to 25.
Okay, well done, team F, 25 marks. So I think this round you have almost leveled up with each other. There is a slight gap which you will get enough time to push to, but I want to know, did you enjoy the round 2? So we have moved from history to more of concepts, and now as we move further, we move on to more of clinical aspects. Yes, so round 3 is going to be a round where you are going to dare to diagnose the condition, right? So these will be clinical vignettes. They'll be on your screen. I will also read them for you. 2 questions per team. And the first round, I'll go clockwise. The second round, I'll go anti-clockwise. A correct answer will give you plus 20. There are no negative marks. Time limit is 1 minute. I think I'm not going to keep any pass because it just creates a lot of confusion because the other team starts getting the hints. Okay. So are you ready? So there'll be a total of 12 cases, 2 cases per team. So we're going to start with team A. Are you ready, team A?
yes, ma'am.
All right. So put your thinking caps on because you have to dare to diagnose. So first question for team A. You have a 40-year-old woman who presents with viral prodromal symptoms for 3 weeks after receiving the tetanus vaccine and 2 weeks after receiving the MMR and the varicella vaccine. She previously had the MMR vaccine as a child without any known post-vaccination adverse events. She has recently been visited by a family, including a relative with an upper respiratory tract infection. She was originally thought to have sinusitis, but she presented again 3 days later with new onset bladder and bowel retention. She was thought to have concomitant urinary tract infection and was discharged on nitrofurantoin. She finally presents to the hospital 3 days later with bilateral lower extremity weakness, numbness, several upper extremity tremors, vertigo, and intractable vomiting. So examination findings क्या है? High frequency, irregular, bilateral upper extremity tremors, more severe on the left, present at rest, posture and with action resembling Holmes tremors, but smaller in amplitude and without a significant proximal component. Fundus examination reveals papillitis. I'm going to also show you the MRI findings and then I'll keep showing you the question again. So this is the MRI of the patient and you have to diagnose the condition for me. Okay. So I'll keep your timer starts now. The MRI will stay on the screen for a few seconds.
Ma'am, can you show the question again?
Yes, absolutely. So
question.
these are the clinical findings and then I'll show you her history as well.
দাদা সিরিঙ্গোমায়ালিয়ার দিকে যাচ্ছে কি?
না 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 সিরিঙ্গোমাইলিয়া যেতে কেন আমার এসএসপি লাগছে এসএসপি মিজেলস ভ্যাকসিনেশন থিং
পোস্ট মিজেলস আচ্ছা
হ্যাঁ
না
পোস্ট মিজেলস
তার সাথে তো এই ব্লাডার আর আপার রেসপিরেটরি ট্র্যাক্ট সিম্পটমস অ্যাকচুয়ালি তো হয়েছে রেসপিরেটরি ট্র্যাক্ট থেকে মনে হয়
আরে তুই আরেকবার দাঁড়া একবার কোশ্চেনটা দেখতে ম্যাম ক্যান ইউ শো দ্য কোশ্চেন अगेन
Yeah, this is the question. This is the history
and
part.
MRI finding.
You want me to change it to the second slide?
Ma'am, from the first.
Yes, it's on your screen now.
Papillitis bolbe.
Time up, ma'am.
Okay.
MRI once, can you show it?
Yes, MRI. Absolutely. Yes. That's the MRI, bacha.
No, white leuko yes.
Ma'am, we are multiple leukoencephalopathy hote pare. PMLE.
হ্যাঁ সেটাই বলছি এসএসপি লাগছে
না এসএসপি না পিএমএলই কোনটা
PMLE টা কি হচ্ছে progressive multiple leuko না ওটা ম্যাম we are going with this is from the measles vaccine so we are going with SSP panencephalitis because there is jugs are there and also there is a leukoencephalopathy can be seen in the MRI few spots and yeah, it occurs many years after vaccination maybe from the childhood only measles vaccination only she had such a issue.
Okay, is that your final answer, Mayuk?
Yes, ma'am.
All right. So, unfortunately, it's not correct. And the reason why you get confused because it is actually resembling the post-viral syndrome encephalitis. That is why you're getting confused because it actually resembles the condition. The condition is anti-MOG encephalitis. Do you know what is MOG? Myelin oligodendrocyte glycoprotein. Yes. So what happens is it resembles your acute disseminated encephalitis, which is what is happening in, post-viral syndromes. As you can see, it is a demyelinating lesion. Gray matter areas are affected. Disc edema, papilledema, anterior optic nerve is affected, and the spinal cord is affected. So because these two areas are affected, there is vision loss and there is paralysis. So basically involvement of the conus when we say bladder and bowel movements or retention is there. Okay, so this is anti-MOG encephalitis beta. Myelin oligodendrocyte glycoprotein. Okay. So basically antibodies are forming against this glycoprotein and that's what is leading to this. Yes, a tough one for you, but no worries. You tried and you tried well. We're going to move on to Team B. Team B, are you ready?
Yes, ma'am.
Okay. So Team B, A 52-year-old woman who is taking immunosuppressive therapy for rheumatoid arthritis presented with 1 month history of painful plaques on both the palms. Biopsy gave the diagnosis. What is the probable diagnosis?
Ma'am, it is sweet syndrome.
I can't hear you, Soumya, for some reason.
Ma'am, it is sweet syndrome. It is a neutrophilic dermatosis that develops generally after cancers or after chronic connective tissue diseases like rheumatoid arthritis. It presents as painful plaques on the mainly palmoplantar distribution. And on the histopath also we can see the neutrophils infiltrating into the skin layers, the dermis.
All right. So is that your final answer, bacha?
Final. Yes, ma'am.
All right. So very, very well done. Absolutely correct. This is sweet syndrome. So plus 20 for team B. Do you know what else is it called as? So it's also called as yes, febrile neutrophilic dermatosis, and it is generally associated with immunosuppressive therapy, but can be associated with malignancies as well, like leukemias, like AML, and you usually see it as a painful rash. What is the treatment?
Corticosteroid.
Yes, yes. Which immunosuppressive therapy is it usually seen with? Azathioprine. Okay. So well done, boys. So plus 20 for team B. Team C, are you ready?
Yes, ma'am.
Okay, bacha. So your question is, a 48-year-old man presented with rash, cough, shortness of breath and arthritis. He experienced fatigue, fever and weight loss for more than 6 months duration. Examination revealed an increased respiratory rate and hypoxia. Fine crackles are audible at the lung bases. Multiple joints were arthritic, but muscle weakness was not clinically present. What is the diagnosis?
Wait, Mukul, hello.
हाँ बोल किसकी तरफ एक बार थोड़ा सा हिंट कुछ आ रहा है?
रैश को देख के लग रहा है सोरियासिस टाइप का. सोरियासिस से आईएलडी होता है.
सोरियासिस से आईएलडी हो तो सकता है, मगर ऐसा मतलब है नहीं, कोई भी एग्जैक्ट थोड़ी है आईएलडी
नहीं.
फाइन क्रैकल्स और ऑडिबल. कैप्लान का कुछ लग रहा है. कैप्लान का मतलब देख आरे हाथ भी हो गया, उसके अंदर तेरे लंग्स भी उसमें इन्वॉल्व हो गए और फीवर भी हो गया. ठीक है, मतलब बस ये आदमी नहीं समझ में आ रहा. कैप्लान में आदमी की आंख का क्या है?
हाँ, हो सकता है कैप्लान.
बट मसल वीकनेस वाज नॉट. ये कैप्लान में सब कुछ बैठा है, मतलब हाथ वाथ जॉइंट पॉइंट. रैश
को लेके बस क्या करना है?
Time up, ma'am.
Time up, team C. Bacha, do you want to give me the answer?
बोल दे मुकुल.
डर्माटो.
रुक जा, क्या बोल रहे हैं? बोल. हाँ बोल दे.
कैप्लान के साथ जाऊं?
डर्माटो वाला क्या बोल?
किसके साथ जाना है? किसके साथ जाऊं?
डर्माटो वाला क्या?
मैं कह रहा हूँ डर्माटोमायोसाइटिस वाला गॉट्रॉन.
हाँ बोल दे.
डर्माटोमायोसाइटिस के साथ जाते हैं. कैप्लान में रहने दे.
हाँ बोल दे.
कैप्लान या डर्माटोसाइट बोल जल्दी. डर्माटोमायोसाइटिस.
Is that your final answer?
उसमें मसल वीकनेस होगा ना यार. कैप्लान
गॉट्रॉन. कैप्लान में डर्माट में मसल वीकनेस होती है. कहाँ होती है?
अच्छा ठीक है, बोल दे. डर्मा बोल दे.
मैम वी गो विद डर्माटोमायोसाइटिस. क्या? No, मैम फाइनल इज कैप्लान.
Is that your final answer?
Ma'am, final is dermatomyositis.
Oh God! So that is your final answer, and either which ways,
yes, ma'am. Yes.
You were on the correct track, but the final answer is still wrong. Okay. Now, can you tell me why this is not dermatomyositis? Because yes, it resembles this, and it's actually a variant of dermatomyositis. मगर जैसे आपके partner ने बोला था, dermatomyositis characteristically has what? muscle involvement. There is
Muscle
muscle weakness. This is actually amyopathic dermatomyositis. This is the variant of dermatomyositis where the manifestations are very similar, but there is no muscle involvement. Okay, so that is the answer. Remember that it is associated with anti-MDA5 antibodies and rapidly progressive interstitial lung disease. Okay, so it is amyopathic dermatomyositis.
मैम
तो
हाफ पॉइंट्स नहीं मिलेगा.
नहीं नहीं
dermatomyositis के लिए हाफ नंबर.
नहीं, dermatomyositis है ही नहीं ना ये. Dermatomyositis is with muscle weakness. This is classically not dermatomyositis. Okay, it has that in the word, but it's a variant of it. Okay, so no half marks.
Okay.
All right, team C, better luck next time. But you are on good thinking tracks, and listen to each other more and talk a little more with each other. है ना? Chalo,
Yes.
team D, are you ready?
Yes, ma'am.
Yes,
All
ma'am.
right. Yes. So Arush and Ayan, this is your question. I'm going to read it out for you. So there's a 57-year-old man with a 10-year history of type 2 diabetes mellitus, presents to emergency with lightheadedness. He has been on metformin and empagliflozin for last 6 months, and HbA1c value is 5.7 1 month back. He was currently on a low-carb diet and has been NPO that day for an OPD dental procedure. The episode of lightheadedness began 1 hour prior and was associated with nausea and tachypnea. A friend checked CBG and it is 122 milligrams per deciliter. The vitals are given to you. Explain the condition. Some lab parameters are also given to you. In case I am hiding out the lab parameters for you, I'll try and move myself.
And it is good enough.
Are you able to
Yes,
see it,
ma'am.
बच्चा?
Ma'am, we can see. Yes, ma'am.
अच्छा, ठीक है.
आरोस इसमें डायबिटिक कीटोएसिडोसिस हो रहा है और टाइप 2 डायबिटीज है.
हो
है ना? एनायन गैप बढ़ा
हो रहा है, लेकिन भाई ग्लूकोज देख 122. डीके में तो 200-250 पार होता है.
अच्छा.
एसिडोसिस है, बाइकार्ब ठीक है, फिट हो रहा है, कीटोनीमिया फिट हो रहा है, एनायन गैप
बड़ा है. हजमा है.
हाई एनायन गैप मेटाबॉलिक एसिडोसिस विद कीटोनीमिया विद नॉर्मल ग्लूकोज.
नॉर्मल ग्लूकोज है.
डीके तो नहीं देंगे भाई.
एक वो होता था ना कीटोसिस प्रोन डायबिटीज.
केपीडी लाड़ा लग रहा है क्या?
हाँ, केपीडी, क्योंकि टाइप 2 में तेरा कीटोन बन रहा है तो मे बी वो ही हो. और
वो तो लिख ही रखा है 10 ईयर हिस्ट्री ऑफ टाइप 2 डायबिटीज में भी गलत डायग्नोसिस बना रखा है क्या डॉक्टर ने? Weird है. Presented to the emergency with lightheadedness. कीटोसिस किस में होता है? केपीडी 1.5 यही होता है ना? केपीडी और लाड़ा ही होते हैं ना, दो 1.5 डायबिटीज.
केपीडी है ये. हाँ, केपीडी लग रहा है मेरे को तो.
भाई डीके हुआ ना तुम.
पर भाई ग्लूकोज कैसे?
That day for an OPD dental procedure, currently on a low carb diet.
Time up, ma'am.
हाँ जी बच्चा. Team D, time up. बच्चे, do you want to commit an answer?
क्या वो केपीडी बोलते हैं क्या?
भाई मुझे मत बोलियो, अरे ये डीके निकला तो.
तो बोल रहे थे मैम, इट इज कीटोसिस प्रोन डायबिटीज.
Ketosis prone diabetes. Diagnosis क्या है?
मैम मेटफॉर्मिन एम्पैग्लाइफ्लोजिन का कोई लफड़ा तो नहीं है? मैम ही इज ऑन एम्पैग्लाइफ्लोजिन एंड वी आर नॉट गिविंग हिम शुगर, तो ना.
वो तो उसके साथ होता था एक आध.
हाँ, नहीं इससे नहीं होता वो.
हाँ जी boys, waiting for your answer. Your time is up बच्चास.
क्या वो DM 1.5 होती है क्या?
डायग्नोसिस नहीं पूछ रहे भाई, ये कोई कंडीशन है डायबिटीज में जो होती. कुछ और ही चक्कर है ये. ग्लिफ्लोजिन से यार शुगर निकल रहा है, किडनी से एब्जॉर्ब नहीं हो रहा.
अरे ग्लिफ्लोजिन से वो होता था ना कि कीटोसिस हो जाता था पर पता नहीं चलता था, मतलब
नाइस.
तो वही लग रहा है कि उसकी मैकेनिज्म क्या थी.
मैम बिकॉज़ ऑफ द ग्लाइफ्लोजिन द पेशेंट इज उसका सिम्टम तो
हाँ, पेशेंट इज हैविंग व्हाट आरोश?
मैम उसको ना मैम ग्लूकोज नॉर्मल वाला कीटोसिस हो रहा है एम्पैग्लाइफ्लोजिन की वजह से. ग्लूकोज नॉर्मल का डीके हो रहा है उसको.
Because of
नॉर्मोग्लाइसेमिक डीके बिकॉज़ ऑफ एम्पैग्लाइफ्लोजिन.
चल
Keto.
अब मैं फाइनल आंसर है तेरा. So very good and very good because it's absolutely the correct answer. It is euglycemic diabetes ketoacidosis. So सही जा रहे थे. इसे कहते हैं. This is how you have to actually pick up keywords. जो तुमने end में pick up किया, तुमने realize किया gliflozin तुम भूले बैठे थे. And that is actually the risk factor for causing euglycemic diabetic ketoacidosis. End में तुमने gliflozin पकड़ा और फिर then you could give the correct answer. So yes, this is definitely ketoacidosis. The bicarbs are less than 18, pH is less than 7.3. Sugar is absolutely normal. और इसका triad होता है. Triad पता है तुम लोगों को? There is increased anion gap metabolic acidosis, which you guys said actually. Then there is ketonemia or ketonuria and normal blood glucose. So this is the triad. अब याद रखोगे? So very good. I like the approach, and that is what we have to learn as clinicians as well. So wonderful. Well done, boys. So a +20 for team D. Good going. So team E, are you ready, bachas?
Ma'am, excuse me.
Hanji.
Ma'am, I think in the last question a lot of time was taken.
In the last question.
Yes.
भाई कोई strict वो थोड़ी है.
Everybody, I am actually giving chance to everyone. If they are answering, I let them complete the answer. I never sort of interrupt because sometimes they take time to explain me what they are trying to say because they are questions are like explain. So वो एक second में तो नहीं explain हो सकता. And I think I'm giving equal time to everyone. ठीक है? Who is feeling
मैम अभी तक जो इन पे इजी क्वेश्चन पढ़ रहे थे और हम पे ऐसे क्वेश्चन पढ़ रहे थे, हमने तो कुछ नहीं बोला अभी तक.
अच्छा कोई बात नहीं. Believe me, I'm trying to give time to everyone to let them explain things to me. Okay? So इसीलिए चलो आगे बढ़े. Team E, are you ready?
Yes, ma'am.
All right. So team E, beta, this is your question. Lamba sa hai, my throat is a little bad, but I'll read it out for you. So a 52-year-old man, Mr. A, known case of major depressive, sorry. A 40-year-old male with 15-year smoking history has presented with low-grade intermittent fever, cough, and intermittent moderate hemoptysis for 2 years. He has history of associated weight loss of around 5 kgs. He has been treated on clinico-radiological basis with ATT for 1 year without improvement. He has a past history of right mastectomy for gynecomastia at 17 years and a history of dental caries requiring tooth extraction 2 years back. Presently, he's come to the emergency with a bout of massive hemoptysis, which subsided with bronchial artery embolization. A subsequent bronchoscopy reveals a mucus plug with purulent discharge with yellow granules in the right lower lobe bronchus, which was suctioned. Histopath shows gram-positive bacteria showing Splendor-Hopley phenomena. What is the likely diagnosis?
Splendor-Hopley phenomena. Splendor-Hopley phenomena क्या मतलब है? ये अच्छा.
Gynecomastia and mastectomy history.
हाँ. फिर 2 years hemoptysis नहीं बदली है. Splendor-Hopley.
Dental caries and
ये तो infection नहीं suggest कर recurrent infection ने होता है. बरोबर है. एटीटी तो एना માટે આઈપી કદાચ ટીબી પણ તો ડોક્યુમેન્ટ નહીં થયું હોય. ગ્રામ
positive Splendor-Hopley phenomenon. Splendor-Hopley phenomenon.
क्या है वो?
Gram positive and Splendor-Hopley.
Time up, ma'am.
Hanji beta. Team E, do you want to commit an answer?
No, ma'am.
No answer at all. So we'll pass it to team F.
Ma'am, is it botryomycosis?
Ma'am,
No. So no, we are not passing it now since they answered. Okay.
ma'am, we
Yes,
know the
yes.
answer.
The bacterial infection.
Yes, time's up, team E. Are you committing any answer?
Botryoomycosis, actinomycosis.
You have to give me one answer, Bache. You can't keep giving me multiple answers. Quickly.
Actinomycosis.
Sorry? Okay, I will give it to you because you did finally reach to the answer. It is pulmonary actinomycosis. What was your hint in the question?
Ma'am,
Anji?
there is a doubt. Like, ma'am, first they said botryoomycosis, then you said ki it is not correct, ma'am.
No, I didn't say that. I said, are you committing your answer?
Ma'am, team F answered actually.
Yes,
Team,
Yes, ma'am. Team F had answered the question. Yes, ma'am.
Team F answered?
yes.
Team F, why did you do that?
No, ma'am. He answered.
I didn't hear Team F. So Pragadish, did you answer the question?
Ma'am,
No.
he answered. Team E.
Team E answered.
Yeah, Team E answered. So if there, so let me ask the scorekeepers also. There are two other scorekeepers who are absolutely neutral. Which team answered?
Ma'am, team E only answered for that.
Team
Yes,
E
ma'am.
only answered. So any doubts with any of the other participants, Bache? So even I heard only Team E answer. Pragadish was saying that he knows the answer, but he did not speak out the answer at all. Am I right, Pragadish? So he did,
Unmute your
so he hasn't.
Pragadish, please unmute your
But it's
speaker.
okay. He didn't answer the question. He said he knows the answer. That's what he said, right? So I'm going to still give it to Team E. So plus 20, it is pulmonary actinomycosis. Sulfur granules, yellow granules is your typical hint. It causes atelectasis and pneumonitis, which is what you're actually seeing. And the male incidence is predominant, and the peak age incidence is 4th and 5th decade of life. Okay. So Team E gets 20 marks for that. Team F, are you ready for your turn now?
Yes, ma'am.
Yes, ma'am.
Okay, Team F. So this is your question. A 52-year-old man, Mr. A, known case of major depressive disorder with polysubstance abuse and poorly controlled type 2 diabetes, is found unconscious and incontinent of urine in his room and admitted. On arrival, the patient is afebrile and stable with a respiratory rate of 18. He is lethargic, oriented to self with dry mucous membranes. Urine toxicology screen was negative. What is the likely diagnosis for Mr. A? Some lab parameters are given to you. Are you able to read the lab parameters?
Ma'am, lower part is not visible.
The lower part is not visible. Okay, I'm going to shift so that you're able to see. Is that okay?
Yes, ma'am. Bicarbonate is elevated, like some compensation. Parathyroid, parathermon is decreased. Hypercalcemia with parathermon decreased. So as a compensation, it should be. Creatine is increased. What are the stable, dry? All renal parameters are increased and hyperglycemia. Okay, could it be diabetic ketoacidosis?
I don't know. You have to tell me if you're committing your answer, bacha.
Diabetic ketoacidosis, renal involvement.
Time is up.
Okay, time is up, Team F. Can you please commit your answer, bacha?
Hyperosmotic, hyperosmolar coma.
Is that your final answer? Can I lock
Yes,
it?
Yes, ma'am.
All right. So unfortunately, it is not correct, although you did pick up the key things in the findings. So you saw that, bicarb is raised. This is a typical case of milk alkali syndrome. Have you heard about it?
Yes, ma'am.
Yes. So mostly, because of calcium toxicity, calcium carbonate use, there is hypercalcemia with metabolic alkalosis. Generally presents as vertigo, confusion, nausea, vomiting, anorexia, polyuria, as well as renal calcification. Yes. What are the typical findings? Hypercalcemia, normal magnesium levels, phosphate will be slightly low, and low PTH, right? So those are the findings in this. So this is actually milk alkali syndrome. Okay.
Yes, ma'am.
Right. Team F, since we are going to go anti-clockwise for this, are you ready also for your second question, beta?
Yes, ma'am.
Yes, ma'am.
All right. So your question is on the screen now. A 24-year-old male from Assam, known case of HIV, is being evaluated for new onset fever, has constitutional symptoms, pallor, hepatosplenomegaly, and some skin lesions. A skin biopsy is done. What is your diagnosis and how will you treat the patient?
அக்கா
HIV
ஸ்போரோட்ரைகோசிஸ் தான் இருக்குமா?
no,
ஸ்போரோட்ரைகோசிஸ்.
sporotrichosis இல்ல. அது lymphatic drainage தானே.
அப்ப இது என்ன ஏதோ
இது
ஃபங்கஸ்.
cryptosporidium, cryptococcus.
கிரிப்டோகாக்கஸ் சிஸ்டமிக் தானே இது? cutaneous-ஆ தான் இருக்கு. சிஸ்டம் ஆமா சிஸ்டம் ஹெப்படோஸ்பிளீனோமெகாலி இருக்கு.
I have some more images for you also, this one.
ஐயோ அந்த ஃபர்ஸ்ட் இமேஜ் நியூமோசிஸ்டஸ் இல்ல
இல்ல சிம்டம்ஸ் வந்து pallor, hepatosplenomegaly.
ஆஸ்பெர்ஜில்லஸ் இருக்குமா? ஆஸ்பெர்ஜில்லஸ்
அதுல
cutaneous-உம் இன்வால்வ் ஆகணும், சிஸ்டமிக்கும் இன்வால்வ் ஆகணும். cutaneous systemic.
Time is over.
All right, Team F, time is up, bacha. Do you want to come in your answer?
Crypto,
இல்ல கிரிப்டோகாக்கஸ் நினைக்கிறீங்களா கன்ஃபார்மா?
அதான் நினைக்கிறேன், தெரியல.
Are you committing an answer?
Candida rubrum.
Is that your final answer? Should I lock it?
Candida சூட ஹைஃபை இருக்கணும்ல, அது எதுவுமே இல்லையே.
ஆனா ரெட் கலர் அது எதோ தோணுது, ரெட் கலர் ரூப்ரம் அது எதோ தோணுது, அந்த மாதிரி ஏதோ வரும். கிரிப்டோகாக்கஸ்ல நியோஃபார்மஸ் மட்டும் தான் இருக்கு, வேற பெருசா ஒண்ணும் இல்ல.
Bacha, you need to commit an answer now.
Candida rubrum.
Okay, I'm taking that as your final answer, but unfortunately it is wrong. It is tularomycosis. Do you know the organism? It is Tularomyces marnefi. What is the older name? Do you remember? Actually more popular as Penicillium marnefi. That is the older name and typically affects HIV infected patients, especially in which part of India do you see it? Eastern India. So HIV patient belonging to Eastern India, and especially in HIV patients, spleen is very commonly affected with this organism, and it affects lungs, liver and mouth. So you were picking the things up correctly. So there is cutaneous involvement, there is liver involvement. Okay. And so this is the answer, but unfortunately you gave the wrong answer, bacha. So I'm not going to give you any marks for that. I'm going to move on to Team E. Team E, are you ready? Team E?
Yes. Yes, ma'am.
Okay, your question is on the screen. A 24-year-old male is being evaluated for PUO, pyrexia of unknown origin, has constitutional symptoms like pallor, hepatosplenomegaly and skin lesions. A bone marrow biopsy showed the following. What is the diagnosis and the treatment?
X-ray CT finding
bone marrow biopsy.
Leukemia को क्या क्या? Leukemia के ऊपर लागे तुम? ML AML के ऊपर है? हाँ.
Hepatosplenomegaly and skin lesions.
Hepatosplenomegaly नहीं था कारण के ઇરિથ્રોપોએસિસ ત્યાંથી થાય ને AML માં ને બધામાં બરોબર કેન્સર હોય કે બાયોપ્સીમાં શું દેખાય
Oh, am I hiding one of your images? I'll just move to the other side.
Time is up.
Okay, time is up. Team E, do you want to commit an answer?
Ma'am, is it acute myeloid leukemia?
Is that your final answer?
Yes, ma'am.
Okay. No, it is not acute myeloid leukemia. This is disseminated histoplasmosis bache. All right. And patient typically presents with fever, chills, headache, muscle aches, dry cough, chest pain, and even bloody cough sometimes. So this is disseminated histoplasmosis. Okay. All right. Team D, are you ready?
Yes, ma'am.
Yes, ma'am.
Okay, bacha. So your question, a big one. A 72-year-old right-handed male with history of ischemia CVA 10 years back is brought by his wife at 10 o'clock as he was unable to speak or open his mouth properly since morning. Patient walked on his own, slowly to the OP yawning. On examination, patient is able to obey commands like lifting his limbs, touching his nose, but is unable to follow commands like opening his mouth, smiling, or closing his eyes. He's able to answer all questions asked like his name, age. Extraocular movements are full and free, no deviation. He was unable to protrude his tongue, bilateral. Okay, I'm not able to read it fully. Can you read the question?
Yeah.
Yes, ma'am.
So vitals, pulse is 80, normal rhythm, BP is 150 by 90. Respiratory rate is 18 and he's afebrile. Okay. Power is 5 by 5 in both upper limbs and lower limbs with deep tendon reflexes which are intact. That was the part that I was hiding.
Arush, इसमें 5th nerve palsy और 7th nerve palsy है.
There is an image for you as well. So that is your image.
भाई 12th भी गई है देख, protrusion of tongue, jaw jerk, brisk है.
हाँ.
jaw jerk, brisk है मतलब 5th nerve UMN है. 5th nerve UMN का मतलब
हाँ
हुआ
हाँ 5th nerve UMN है.
पॉन्स के भी ऊपर है यार. वैसे है तो cerebral lesion है, ठीक है, तो obviously पॉन्स के ऊपर ही है.
5th और 7th वो lateral pontine.
भाई ये
lateral pontine हो सकता है ना.
देख लैक्यूना बन गया है मतलब पूरा होली बन गया cerebrum में. Ma'am, can you show the question?
Question. This one, ये क्या yawned again while
palatal reflex is absent. Bilateral palatal reflex were
absent है. Palatal क्या 9 और 10 ना.
हाँ भाई 7 5 7 9 10
Time up.
मुझे हटा दिया कर, वो मैं आगे आ रही हूँ.
वो होगा lateral medullary.
ले आओ.
lateral
Is
medullary.
time up?
Time up.
Goalkeepers,
Yes,
time
ma'am,
up,
time.
boys.
ना lateral medullary तो नहीं लग रहा. हॉर्नर के फीचर होते हैं, डेफिनेटली दिए होते हैं हॉर्नर.
7 9 10 वो तो नहीं है. वो जहाँ से क्या होता है.
ये ब्रेन स्टेम सिंड्रोम लग भी रहा है, मेरे को तो नहीं लग रहा. तू सेरिब्रम देख भाई.
हाँ
Boys,
वो
you have to answer now.
वर्नेट सिंड्रोम.
नहीं 9 10 11 होता है वो. वही बोल रहा है ना.
हाँ वही
जुगुलर फोसा वाला.
हाँ.
Boys, time is up. You need to give an answer.
आंसर देना है. बता लैक्यूना क्रिएट हो गया इन्फेक्शन की वजह से. नहीं आ रहा है यार दिमाग में कुछ. कोई सिंड्रोम पता है ऐसा? उल्टा सीधा सिंड्रोम होगा कोई.
मैरी फॉक्स होता है, वो पता नहीं क्या होता है.
अरे नहीं, ब्रेन स्टेम सिंड्रोम्स है वो सारे. ये सेरिब्रम से रिलेटेड है भाई कुछ.
क्या करें?
You need to give an answer. Ayan and Arush.
क्या बोले आप?
चलो फिर मैं आंसर बता रही हूँ।
एमसीए करेंगे। इंसुलर
जल्दी।
इंसुलर रीजन है ना, इंसुला का इन्फार्क्ट हो गया मैम, कोई लैगुना बन गया एमसीए की वजह
अच्छा
से।
ठीक है, अब मैं आंसर बता रही हूँ. Your answer is incorrect and you should have listened to Ayan. He was actually saying the answer. Yes, it is Fox-Marie syndrome. There is bilateral and anterior opercular syndrome. Basically, thrombotic या embolic stroke की वजह से होता है. Involvement of frontal lobe, temporal lobe, parietal, cortical lobe. Okay, it is a form of pseudobulbar palsy. So there is involvement of facial muscles, labiopharyngeal, glossopharyngeal. Basically, the mastication muscles are the ones which are affected. That is why he is not able to speak or yawn or these things, but other things are intact. So there is bilateral corticobulbar involvement. Okay?
Sorry, bhai.
Chalo. Okay, so no marks on this one. Team C, are you ready, bacha?
Yes, ma'am.
Right, so that is your question. There is an image also which I will show. So there is a 35-year-old male comes with complaints of right flank pain for 2 months, dull aching type, not radiating, back pain for past 1 year without any aggravating or relieving factors. He's complained of exertional dyspnea. General examination reveals cyanosis at the lips and fingers and telangiectasia in the oral cavity. Saturation is 91, vitals are normal. Ultrasound shows perinephric fluid collections around both kidneys, but more on the right side. Echo shows normal LV function, preserved ejection fraction, no chamber dilatation. The values are given to you. CBC, LFTs show a reversal of AG ratio and increased globulins. Erythropoietin levels are raised. What is the likely diagnosis?
Any image also?
Yeah. I'm so sorry.
Yes, ma'am.
There's no image in this question.
To be honest, I've seen the slide.
Okay, so then
the answer Tempe syndrome was written.
Yeah, so then yeah, I thought there was a slide, but we can't give it to you. Did you know the answer anyways?
Tempe का idea था, लेकिन I have seen the slide, ma'am. So
ठीक है. So we can't give you marks on that one, although it is my fault. But I don't think we have an additional question for this round, and unfortunately, I'll not be able to give it to you. Team C.
we could think, मतलब Tempe का idea था, लेकिन देख लिया मैम तो सोचने का time नहीं मिला, मैम. Any spare question, ma'am?
Spare question, clinical nahi hai, that is the problem. And you have to have the same level of the question as well. So unfortunately, abhi nahi hai. We'll see if we have an additional question towards the end in some other format, but no, we would not be able to give you any marks, but apologies, that's my mistake for this one. Hanji.
क्या हुआ?
ये तो गायब था. Where was your partner? He was not there. Okay.
Did he give any answer?
No, he wasn't. He was thinking, but he could see the answer slide. So we can't really give it because it will be unfair to the other teams.
हम लेकिन क्विज के अगर हिसाब से चले तो इक्वल अपॉर्चुनिटी हर को मिलनी चाहिए, उस हिसाब से क्वेश्चन तो होना चाहिए, मतलब देख लिया.
So we'll give you another question towards the end. Magar usme it will not be a clinical question, but it will be something that we will give you marks. Matlab we'll make you answer a question. Okay, abhi we'll move forward. We'll move to team B. Yes, team B, are you ready?
Yes, ma'am.
Okay. Okay, so team B, a 70-year-old female presents to OPD with following features. She said that her hands and feet felt like memory foam and was extremely painful in the morning for first 40 minutes of the day. RF, anti-CCP antibody and ANA all are negative. What is your diagnosis?
ये कब सुना भी नहीं है. मेमोरी फोम है ये. मेमोरी फोम किधर हो? उसका फीट फील हो रहा है ऐसा एज अ मेमोरी फोम. हाँ तो वो क्योंकि इडिमा हो गया ना, इडिमा हो गया, ठीक है। एक्सट्रीमली पेनफुल इन द मॉर्निंग, लाइक पेनफुल इन द मॉर्निंग, मॉर्निंग स्टिफनेस मान लो, ठीक है, मॉर्निंग स्टिफनेस अगर मानोगे तो, लेकिन ये सीरो नेगेटिव है, देख तो सीरो नेगेटिव कोई उसके बारे में सोच, सोरियाटिक हो सकता है क्योंकि यहाँ पे देख डैक्टिलाइटिस वगैरह हो सकता है कि मान लो कि सॉसेज चिप पे डिजिट टिकाना चाह रहे हैं, ठीक है, अभी के लिए उतना है कि तुम्हारा
ये नेगेटिव है, ये मोस्ट प्रोबेबली हो सकता है
तो एन नेगेटिव
कैंसर की वजह से हो रहा हो ना,
तो एन नेगेटिव ही तो होता है, वो जो सोरियाटिक आर्थराइटिस होता है सीरो नेगेटिव ही तो है, तो एन तो चलो कोई नहीं, वो तो कोई दिक्कत नहीं है,
सोरियाटिक स्टेज में नहीं है वो।
Time is up.
Okay, time is up, team B.
मैम
जी,
वी
मुझे
थिंक
काम-
वही दे देना, अब तो कुछ कर नहीं सकते हो,
तुम वो कर दो ना, वो मेरे को लग रहा है कोई कुछ तो मतलब दे दो।
Ma'am, we think it is psoriatic arthritis showing dactylitis, and it is a seronegative spondyloarthropathy and inflammatory arthritis. Therefore, morning stiffness and seronegative, we can see RF factor negative, CCP negative.
So, no, unfortunately, yes, it is seronegative. That is the only correct word you have used. But that's because it's very evident from the question itself. What is the diagnosis that is incorrect, bacha? So, diagnosis is RS3PE. Have you heard of this? Remitting seronegative symmetrical synovitis with pitting edema. So, there is polysynovitis. There is typical involvement of the dorsum of hands, dorsum of feet. And it is actually a manifestation of RA, but yes, the RA factor will be negative. It is generally seen in, the other key thing was what? Elderly females, right? So elderly mein zyada hota hai, and it typically has good prognosis. Okay. So which infection can you see this with? Do you have any idea?
No, ma'am.
So Burkholderia pseudomelae, right? So uske साथ भी मिलता है. Okay, so no marks on that one. Team B. Team A, are you ready?
Yes, ma'am.
All right. So Team A, this is the question for you. 54-year poorly controlled diabetic patient presents with PUO, cavitatory pneumonia, septic shock, and prostatic abscess. There is history of fever for 2 weeks, vomiting, altered sensorium, and ataxia for 3 days. CSF shows lymphocytic pleocytosis. MRI findings are shown to you. What is your diagnosis and treatment, bache?
Lymphocytic pleocytosis. Lymphocytic.
Poorly controlled DM বলতে মানে immunocompromised তো আছে।
Pleocytosis কোথায় পাওয়া যায়? তো কোনো আইডিয়া আছে?
লিম্ফোসাইট বেড়ে গেছে মানে তো ব্যাকটেরিয়ালে নিউট্রোফিলিক বার, এটা যদি মেনিনজাইটিসের দিকে যায়, আগে বলো মেনিনজাইটিসের দিকে যাচ্ছে কিনা। লিম্ফোসাইটিক হলে ভাইরালও হতে পারে কিন্তু
হাইপো ভাইরালই হওয়ার কথা। Can you show the question again? CSF এ ইয়ে আছে, prostatic abscess আছে। Prostatic
ক্যাভিটেটারি
abscess আছে।
নিউমোনিয়া বলছে, ক্যাভিটেটারি নিউমোনিয়া বলছে। এইটা
ক্যাভিটেটারি নিউমোনিয়া মানে হচ্ছে কোনো উইগনার্সে তো ইয়ে হবে না।
না না, আমার মনে হচ্ছে এটা ইনফেকশন, কারণ নইলে সিএসএফ এর লিম্ফোসিটিক প্লিওসাইটোসিস দিত না।
হ্যাঁ, তাহলে কি ইনফেকশন হতে পারে?
ভাইরাল ইনফেকশন তো হওয়ার কথা, কোন লিম্ফোসাইটিক ভাইরাল কিছু একটা বলো।
Time is up.
Bye.
Yes, bache. Team A, time is up.
Lymphocytic ataxia, yeah.
হ্যাঁ, জেসি ভাইরাস হতে পারে না, জেসি ভাইরাসের প্রেজেন্টেশন এটা না।
না না না, please hostel बोलो क्या?
You have to commit an answer, bacha.
জেসি ভাইরাস দিয়ে দেবো মানে আর কি?
জেসি ভাইরাসে তো লিউকো ইয়ে হয় না।
আচ্ছা,
আরে ওই হোয়াইট ম্যাটার,
এটা ভাইরাল এনকেফেলাইটিস বলি, ওইটা অ্যাট লিস্ট বলবো।
হ্যাঁ ওটা। This is a case of viral meningoencephalitis, non-specific, and we have to be more specific about it.
Yes, there is a typical name that you have to give me.
ভাইরাল মিনিং
ক্যাভিটারি
এর নাম চাই
কিন্তু ভাইরাল ইয়েতে ক্যাভিটারি লিশন
Time is up, bacha.
দেশি ভাইরাস বলে দাও না
দেশি ভাইরাস যেটা হয়
ক্রিপ্টোকক্কাসের তো কোনো পাচ্ছি না ক্রিপ্টোকক্কাসও হতে পারে বলে দাও ক্রিপ্টোকক্কাস
না 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 এটা তো ভাইরালই লাগছে viral meningoencephalitis.
Okay, is that the final answer? I'm taking it as the final answer. Yes.
It can be
Yes,
JC
ma'am.
virus also. You can take the name.
Okay, so this is an incorrect answer, bache. So this is neuromelioidosis. Have you heard about it? So typical history of prostatic abscess, cavitatory pneumonia, septic shock in a patient with poorly controlled diabetes is what gives you the answer. MRI mein kya hai? Trigeminal root enhancement is there and it spreads along the corticospinal tracts and you need to drain the abscess, control the sugars and manage her with antibiotics. Okay, so unfortunately this is wrong. And team C, okay, so are you ready for your question, that additional question, team C?
Yes, ma'am.
Okay, so the question is going to be from my side. So you are seeing a patient 7 days after a vaginal delivery. She presents with fever, okay, and you do a pelvic examination, which is absolutely normal. She is not responding to antibiotics. There is no other significant finding. MRI of the pelvis is not showing any changes. What is the diagnosis?
सेवन डेज आफ्टर बोले ना, तो या तो दो चीज हो सकता है, या तो कुछ फिजियोलॉजिकल रिस्पॉन्स होगा या फिर कोई बैक्टीरिया या फिर ये भी हो सकता है कि मतलब वेजाइनल डिलीवरी में गॉच पीस अंदर छूट गया हो, रिएक्शन हुआ हो, लेकिन एमआरआई में फिर पकड़ लेता। मोस्टली तो मुझे लग रहा है कुछ फिजियोलॉजिकल रिस्पॉन्स होगा, मतलब फिजियोलॉजिकल हाइपर स्टिमुलेशन, कुछ इंटरल्यूकिन्स, मतलब कुछ साइटोकाइन बढ़ जाएगा डिलीवरी के बाद। सब कुछ तो रूल आउट हो गया ना, सारा इन्वेस्टिगेशन। तो क्या लगता है देखो?
नो, मेरे को तो कोई आइडिया नहीं आ रहा, मतलब एंटीबायोटिक्स के साथ क्या था, नॉट रिस्पॉन्डिंग है ना?
हाँ, एंटीबायोटिक रिस्पॉन्ड नहीं कर रहा, एमआरआई पे भी कुछ नहीं है, तो इस केस में क्या ही हो सकता है? कुछ इन्फेक्शन, पीओ भी नहीं हुआ 7 दिन, तो काफी वीक सा हो सकता है कुछ।
Scorekeepers, are you keeping track on time, bacha?
Yes, ma'am.
Yes, ma'am.
Okay.
Ma'am, now
बोल
it's
दे
over.
याद ऐसे कुछ एंडो
Time's up, team C.
एंडोमेट्रियल में एंडोमेट्राइटिस कर दे।
एंडोमेट्राइटिस
Are you committing an answer?
बोल, मेरे को तो कोई आइडिया नहीं है।
बोल दे। हम मोर ऑफ फिजियोलॉजिकल कुछ हाइपर स्टिमुलेशन हो गया, लाइक डिलीवरी भी।
मुझसे पूछ रहे हो या मुझे बता रहे हो? You have to give me an answer, बेटा।
हम स्पेसिफिक चाहिए एकदम।
हाँ जी, डायग्नोसिस चाहिए।
बोल दे यार, तू ही बोल दे, एंडोमेट्राइटिस बोल रहे।
मैम एंडोमेट्राइटिस।
Okay, so that is incorrect. That is a DD. But since we said pelvic examination में सिर्फ tenderness है, I didn't talk about uterine tenderness or subinvolution or a foul smelling discharge. So यही सोच के उसको antibiotic शुरू किया था कि endometritis होगा, but she didn't respond. So this is a classical case of septic pelvic thrombophlebitis. Do you know that pregnancy and especially postpartum is a highly procoagulant state? Yes. So this is how these women will present. They'll develop fever usually within 1 week or by the first week. And typically a lot of times when you do a pelvic exam, sometimes you may feel a cord-like ovarian vein. It is usually the right ovarian vein which is affected more than the left. Why? Because it is without any valves and it has a longer course. So right vein is affected first. So kabhi you can feel it like a cord-like structure. If you don't feel it, we will either do a CT or an MRI, but they will only show findings if it is obviously thrombosed. They can turn out to be normal. So what do? So now once she is not responding to antibiotics, you have to prophylactically start her on heparin as well. So anticoagulant has to be started. So we give a combination of both anticoagulants and antibiotic, and then she'll respond. Okay, and the minimum time that we give anticoag is after 48 hours of when the fever subsides, if there is no evidence of a thrombosed vein. If there is evidence of thrombosed vein, then we will give anticoags for a period of 6 weeks. All right. So now you got a fair chance to answer.
Yes, ma'am.
All right. So can we have the scores at the end of round 3, beta?
Yes, ma'am. After completed,
scorekeepers?
yes, ma'am. After completed round 3, the marks is team A is 30.
Well done, team A, 30 marks.
And the team B is leading with 65 marks.
Very good, team B, 65. Well done.
Team C is 40 marks.
Well done, team C.
Team D is 35.
Close call, team D. Well done, well done.
Team E also 35.
Oh, that's a very, very close match going on. Well done.
And the team F is 25.
Okay, well done, team F. Buck up. We have 3 more rounds to go. We'll take a short break. You guys can go and eat something and come back. We'll take, is 10 minutes break good for all?
Yes, ma'am.
Great.
Yes,
So we will rejoin in 10 minutes, and Dr. Sumer is going to conduct the rest of the rounds with you. So all the very best. It was an absolute pleasure to conduct this quiz with you, bright students, and best wishes to all the teams. So take care. See you after 10 minutes, right?
Ma'am, should we log out or should we stay?
You can stay. You can just put off your cameras. Don't log out. Just put off your cameras and your mic, and you can come back after 10 minutes.